Quoirin dipanggil 6-103-2020 Nora and Quoirin.
Yes.
Dengan izin Puan, Ahmad Sadari bin Umar, Lembaga Pendakwa Raya, selaku pegawai pengendali kes ini, sama-sama saya, TPR Noralis, TPR Nur Hafizah dan TPR Atikah, bagi pihak keluarga mati, Cik Saktiva dan Louis Azmi, dan bagi pihak terdusun Cik Alif Benjamin. Ya pun untuk hari ini kami sedia untuk meneruskan dengan memanggil saksi yang seterusnya, iaitu Dr. Hanif bin Mahmud, pakar perubatan forensik pada Hospital Tunku Jaafar. Dr. Hanif, ya.
I see that. Doktor akan beri keterangan dalam bahasa Melayu.
Bahasa Melayu.
Bahasa Melayu, doktor angkat sumpah. Baca ini, jika ada terminologi memerlukan doktor berbahasa Inggeris, doktor perlu minta izin untuk tulis dalam bahasa Inggeris. Boleh angkat sumpah untuk bahasa Melayu.
Bahawasanya saya, Dr. Hanif bin Mahmud, dengan sesungguhnya dan suci hati mengaku dan berikrar bahawa segala keterangan yang akan saya berikan dalam perbicaraan ini adalah benar, tiadalah apa-apa yang tidak benar, melainkan benar belaka.
Umur doktor sekarang?
38 tahun.
Nama doktor sama seperti kad pengenalan.
Nama berbeza.
Berbeza.
17, nombor 17, Jalan Bangi Villa 4, Taman Bangi Villa, 43,000, Kajang, Selangor. Saya bertugas di Hospital Tuanku Jaafar Seremban sebagai pakar forensik.
Dengan izin Puan, bagi saksi Dr. Hanif pada hari ini, nyata saksi telah pun disediakan dan saya pun terus rujuk kepada saksi kepada pihak saksi.
Saksi.
Louis Azmi, Mr. Sakti, Cik Alif, penyata saksi semua ada eh?
Ada Puan.
Alright.
Ya, doktor boleh terus bacakan penyata saksi yang dihadapkan doktor.
Saya bertugas di Jabatan Perubatan Forensik Hospital Tuanku Jaafar Seremban, Negeri Sembilan. Saya telah lulus dan dianugerahkan ijazah sarjana muda MBBCH BAO daripada Trinity College Dublin, Ireland pada Mei 2008. Saya telah bertugas sebagai pegawai perubatan siswazah atau houseman di Hospital Putrajaya dari tahun 2008 sehingga 2010. Saya telah bekerja sebagai pegawai perubatan di Hospital Tuanku Jaafar Seremban dari tahun 2011 hingga tahun 2015. Saya telah menyambung pengajian peringkat pasca siswazah atau postgraduate studies dari tahun 2015 sehingga tahun 2017 di Academy of Forensic Medical Science London dan telah menerima diploma in medical jurisprudence dalam kurungan patologi pada Februari 2017 daripada Apothecaries London. Saya telah bertugas di Jabatan Perubatan Forensik sejak dari tahun 2011 sehingga kini. Saya kini menyandang jawatan sebagai pakar forensik. Berikut adalah kursus utama yang telah saya hadiri. Saya juga terlibat dengan mesyuarat jawatan kuasa penyiasatan kematian ibu mengandung dan jawatan kuasa penyiasatan kematian kanak-kanak bawah 5 tahun peringkat Negeri Sembilan. Tugas utama saya sebagai pakar forensik adalah menjalankan pemeriksaan bedah mayat berdasarkan arahan daripada pegawai penyiasat. Saya adalah pakar forensik bertugas pada 13 dan 14 Ogos 2019. Saya telah dijemput oleh ASP Rashid bin Kasim dalam kurungan G/13127 untuk hadir ke satu tempat di mana satu mayat telah dijumpai pada 13 Ogos 2019. Saya tiba di tempat kejadian pada jam 4.44 petang hari yang sama. Setibanya saya di tempat kejadian pada jam 4.44 petang 13 Ogos 2019, saya dapati ada satu mayat wanita tanpa pakaian di atas plastik hitam. Pemeriksaan awal ketika itu saya dapati satu mayat remaja Kaukasid yang telah mengalami proses pembusukan di mana mayat berbau busuk, kulit badannya mengelupas dan berubah warna. Mayat adalah sejuk apabila disentuh dan kejang mayat tidak hadir. Mayat juga dihurungi lalat dan serangga serta dimakan ulat. Mayat ini kemudian telah dihantar dan tiba ke bilik mayat Hospital Tuanku Jaafar Seremban pada 13 Ogos 2019 jam 7.10 malam. Saya bersama-sama Dr. Siu Feng telah menjalankan pemeriksaan postmortem terhadap mayat remaja perempuan bernama Nora Quoirin. Pemeriksaan postmortem ini telah diminta oleh ASP Rashid bin Kasim dalam kurungan G/13127. Pemeriksaan postmortem telah dijalankan pada 14 Ogos 2019 jam 11.45 pagi di bilik mayat Hospital Tuanku Jaafar Seremban. Mayat telah dikenal pasti kepada saya oleh ASP Rashid bin Kasim, kurungan G/13127. Kami telah melakukan pemeriksaan luaran dan diikuti dengan pemeriksaan dalaman. Spesimen-spesimen dari badan si mati juga telah diambil semasa pemeriksaan dilakukan. Kami telah menyediakan satu laporan postmortem dengan nombor HTJS 281/2019 Berikut adalah dapatan hasil pemeriksaan postmortem yang dijalankan seperti yang direkodkan di dalam laporan postmortem. Saya memohon untuk membaca laporan di dalam bahasa Inggeris.
Gunakan.
The body was already in a stage of early to moderate decomposition, characterized by foul-smelling, generalized peeling of skin, hair, and marbling. Maggots infestation was also seen with rupture of both eyes. The following were noted on external examination. Height 149 centimeter, weight 35 kilogram, chest abrasion wound to refer marks of injury. Build, average build, hygiene fair, hair long brunette, hair measuring around 40 cm in length, eyes, both eyes were ruptured, conjunctiva, both conjunctiva were pale, face, post-mortem skin changes and damage can be seen right side outer forehead, middle forehead, left side forehead near left eyebrow, mouth, maggots infestation, nose, maggots infestation, teeth, natural dentition, ears, no bleeding or discharge seen, hands, skin wrinkles on both hands and all fingers, fingernails, medium length trimmed nails, feet, skin wrinkles on both feet, abrasion wound, refer marks of injury, external female genitalia, hymen intact despite decomposition and maggots infestation, anus, no significant abnormality detected, body temperature, her body felt cold, rigor mortis, the rigor mortis has passed, postmortem hypostasis diffused, miscellaneous ant bites seen on chest, abdomen, all four limbs, and pelvis area. Generalized skin peeling over the body. The following marks of injury were found on her body. Right abdomen, abrasion 12 times 10 centimeter. Right lower abdomen, abrasion 6 times 5 centimeter. Right flank, abrasion 16 times 10 centimeter. Left chest, abrasion 13 times 6 centimeter. Left upper abdomen, abrasion 12 times 3 centimeter. Left lower abdomen, abrasion 18 times 3 centimeter. Mid abdomen, linear abrasion 3 times 5 centimeter and 10 centimeter above umbilicus. Left back, abrasion 10 times 6 centimeter. Right buttock, abrasion 6 times 6 centimeter. Right shoulder, abrasion 10 times 7 centimeter. Right upper arm, posterior lateral abrasion 13 times 5 centimeter. Right forearm, abrasion 4 times 2 centimeter. Right elbow, bruise 3 times 3 centimeter. Dorsal right hand, abrasion 2 times 1 centimeter. Right fourth finger, bruise 2 times 1 centimeter. Fingers web between right thumb and index finger, a bruise 1 by 1 centimeter. Left upper arm anterior, abrasion 14 times 7 centimeter. Left upper arm posterior, abrasion 19 times 7 centimeter. Right thigh, abrasion 13 times 19 centimeter. Right knee, a bruise 9 times 9 centimeter. Right shin, abrasion 28 times 7 centimeter. Right foot, dorsum abrasion 10 times 5 centimeter. Right foot, plantar, abrasion 7 times 5 centimeter. Right foot, plantar lateral, abrasion 3 times 0.2 centimeter. Middle right foot, deep abrasion 2.5 times 1 centimeter. Left thigh abrasion 19 times 10 centimeter, left shin abrasion 9 times 5 centimeter, left foot's heel abrasion 6 times 4 centimeter. Internal examination revealed the following: head, scalp, subgaleal hematoma over the right parietal region measuring 3 by 3 centimeter with contused bilateral temporalis muscles. No fracture of skull vault and basal of skull detected. Meninges, dura mater was intact and no extradural or subdural hemorrhage seen. Brain, the brain weigh 990 grams, no obvious malformation seen. Tissue liquefaction at the base. On cut sections, the brain parenchyma was unremarkable and no hemorrhage seen. The circle of Willis was intact. Mouth, throat, and neck structures. Tongue unremarkable. Thyroid intact. Larynx patent. Carotids intact. Cervical muscles, no injuries detected. Cervical spine, no evidence of cervical fracture detected. Hyoid bone, no fracture detected. Thyroid cartilage, no fracture detected. Thorax, rib cage, no rib fracture seen. Pleural cavities, no adhesion or effusion seen. Trachea and A passage intact and patent. Lungs, the right and left lungs weigh 260 grams and 370 grams respectively. The lung surface was unremarkable and cut section revealed lung congestion. Pericardium intact. Heart, the heart weigh 150 grams. The epicardial surface was unremarkable. The coronary arteries were patent and arose normally from aorta. The foramen ovale was patent. The heart valves and cardiac chamber were unremarkable. The left ventricular thickness was 6 millimeter on right ventricular thickness was, and right ventricular thickness was 2.0 millimeter. No myocardial fibrosis seen. Aorta was intact. Pulmonary artery, no thromboembolus. Esophagus, no reflux gastric content seen. Abdomen, peritoneum, 50 ml of bile stained fluids, mainly at the pelvic area. No collection of blood, pus, or slough. No retroperitoneal lesion seen. Stomach, the stomach was empty and the mucosa was unremarkable. Intestines, perforation at anterior duodenum. Seal perforation at posterior duodenum. Multiple and varying sizes of punch out ulcers with rim of hemorrhage on duodenal mucosa. Melanic stool at distal small intestine. Colon, melanic stool along the length of colon. Rectum, melanic stool. Mesenteric nodes, not enlarged. Liver, the liver was weighed 570 grams, bile stain at posterior inferior surface. Biliary system, patent. Pancreas, autolytic changes seen. Spleen, the spleen weight 70 grams and congested. Adrenal glands, no adrenal lesion or hemorrhage seen. Kidneys, the right and left kidneys weighed 80 grams each. The cortical surface was smooth and cut sections were congested. Ureters, no significant abnormality detected. Urinary, no significant abnormality detected. Bile stain at outer superior surface. Reproductive system, the uterus was empty and weighed 50 grams. Subcutaneous tissues, the following injuries seen on extensive subcutaneous dissection over body and limbs. Subcutaneous hematoma at right elbow measuring 3 by 3 centimeter. Subcutaneous hematoma at right upper back measuring 3 by 2 centimeter. Subcutaneous hematoma at dorsum of right hand measuring 2 by 1 centimeter. Skeletal system, no fracture detected from post-mortem examination. No fracture seen from skeletal survey radiographs. The following specimens were collected from the deceased during post-mortem examination for laboratory investigation. Samples taken for DNA analysis and trace evidence: hair, pubic hair, left breast swab, right breast swab, left side neck swab, right side neck swab, anal swab, perianal swab, pubis 1 swab, pubis 2 swab, oral swab, left thigh swab, right nail scraping, left nail scraping, low vaginal swab for spermatozoa and DNA analysis, high vaginal swab for spermatozoa and DNA analysis, blood FTA card for DNA profiling, bone for DNA profiling, psoas muscle for DNA profiling. Other samples taken: liver tissue for toxicology, peritoneal fluids for toxicology, psoas muscle tissue for toxicology, fecal occult blood, maggots for entomology examination, selected tissues for histology examination, and selected tissues and water sample from scene for diatom test. Results for DNA analysis: refer Jabatan Kimia Malaysia report with the laboratory number 19-FR-B-19139 dated 30th September 2019. The source of blood stain specimen is the biological child to donor of blood specimen D, label Meep J. Josephine Quoirin, and E, label Sebastian Marie Philip, and biological sibling to the donor of blood specimen F, label Ines Julia, and G, label Maurice Arthur. No DNA profile was developed from hair specimen V1. Label Nora and Quoirin, blood stain on hair specimen V2, label Nora and Quoirin, and swab stick V13 and V14, label Nora and Quoirin. Swab stick 3B and 13B, swab stick V7, V8, V9, V15, and V9, all sperm cell and non-sperm cell extract, and V10 sperm cell extract, all labeled Nora and Quoirin. Toxicology. On 8th January 2020, a toxicology report was received from investigating officer, laboratory number 19-FR-19364 dated 27th September 2019. Liver V20, common drugs not detected, pesticide, organophosphate, organochlorine not detected. Psoas muscles V21, common drugs not detected, pesticide, organophosphate, organochlorine not detected. Peritoneal fluids V22, common drugs not detected, pesticide, organophosphate, organochlorine not detected. Fecal occult blood was positive. Laboratory number 057894448 dated 50th August 2019. Entomology report, refer Institute of Medical Research, National Institute of Health, NIH, report with reference number IPP/EF.075/2019. The Medical Entomology Unit of the Institute for Medical Research, IMR, received 2 bottles of specimens on 16th August 2019 at 8:05 hours. The minimum post-mortem interval, MPMI, is based on the older stage, which is the third instar larva. The minimum age of third instar larva is determined to be at least 4 days, implying the deceased was dead at least 4 days prior to the collection of the larva from the cadaver. Diatom test. Brain, lungs, kidneys, spleen, bone marrow, and water from scene were processed for diatom test. Examination showed no comparable organism found in between the organs and water from scene. Histology findings. The duodenum section showed some degrees of autolysis. Duodenum section showed extensive mucosal degeneration and widespread muscularis mucosa disruption. Transmural disruption of duodenal layers also seen on the section. Food particles seen within the disrupted layers. Pulse stain was negative. Heart section showed some degree of autolysis, occasional myocytes, nuclear enlargement, and hypertrophy seen, otherwise no fibrosis or hemorrhage. Lungs sections showed some degree of autolysis. Pulmonary vessels appeared congested, otherwise no significant pathology. Liver section showed some degree of autolysis. Hepatocyte shrinkage seen surrounding central vein, otherwise no evidence of inflammatory cells infiltrate. The remaining tissues selected at post-mortem examination confirmed gross finding with some degree of autolysis and did not demonstrate any further significant pathology. In summary, the body was identified by ASP Rashid bin Qasim as the above named person prior to post-mortem examination. Post-mortem examination revealed that the body has undergone post-mortem changes. The estimated time of death based on the post-mortem changes is about 2 to 3 days, but less than 4 days. Washerwoman's sign was seen on both feet and hands, suggestive these body parts were immersed in the water. Multiple injuries were found on external examination. These injuries are not fatal in nature. These injuries were caused by friction with objects like tree branches, rocks, sands, etc. The hymen of the deceased was intact despite of decomposition changes. No obvious injury seen on the external genitalia despite decomposition artifact. The dissection of the face, perioral areas, and lips showed no obvious injury to suggest of smothering. Extensive dissection of the skin done to examine the subcutaneous fat and muscles for injuries. No obvious grip marks or struggle marks seen on all limbs. However, there were small bruises on the upper back of right shoulder, right elbow, and hand. This could be from a fall. Internal examination revealed 50 ml bile fluids in the peritoneal cavity. Further examination found a perforated duodenum ulcer with multiple punch-out ulcers, mainly in D1 duodenum section. There was massive amount of melena, occult blood in large bowel, and some occult blood also seen in the small bowel. This occult blood resulted from erosions of blood vessels of above ulcers. In my opinion, the cause of death is upper gastrointestinal bleeding due to duodenal ulcers complicated with perforation. Tissue toxicology analysis were negative. DNA analysis showed she was the biological child to Mib J. Josephine Quoirin and Sebastian Mary Philip. She was also the biological sibling to Ines Julia and Maurice Arthur. Saya mohon ada pembetulan untuk nombor 40. Tarikh saya bersama Dr. Siu Shu Feng telah melawat tempat kejadian semula pada 16 Ogos 2019. Saya dengan ini mengakui bahawa segala keterangan yang saya berikan dalam pernyataan saksi ini adalah benar sepanjang pengetahuan dan kepercayaan saya.
Okay.
Ya, dengan Puan. Doktor sahkan segala pernyataan saksi ini. Puan nak ditandatangan dahulu. Untuk pihak ni yang ada 2 kopi dulu tanda tangan tak? Orang dulu kan tak? Yang boleh tanda tangan. Sama ada mereka perlukan dokumen penyata saksi yang ditandatangani oleh
Tak ada masalah, nanti kita uruskan untuk kasih kita email the sign copy pada di pihak-pihak.
maksudnya nak
Tak, nanti kita akan kasih dia macam the sign copy macam sebelum-sebelum ni kan. Okey, teruskan tuan. My copy apa Aisyah? Okey, teruskan.
Ya, Dr. Hanif, saya ada beberapa soalan tambahan untuk doktor. Pertama sekali, doktor menyatakan ada menyediakan laporan perubatan atau laporan post-mortem bersama dengan Dr. Siu.
Benar.
Rujuk kepada laporan post-mortem tarikh 5 hari bulan Februari 2020.
Benar.
Doktor sahkan dengan laporan post-mortem yang disediakan bagi pemeriksaan yang telah dijalankan.
Saya sahkan.
Ada tantangan doktor
Ada.
Untuk kaunsul dia lampiran 136 lampiran 136, the post-mortem report.
Doktor, dalam keterangan awal doktor menyatakan bahawa mayat ataupun keadaan mayat telah mula in the early stage of decomposition.
Benar.
Nah, namun begitu adakah soalan saya, adakah keadaan body mayat itu memberikan kesan ataupun masih mampu untuk menjalankan pemeriksaan dan tidak memberikan kesan kepada penemuan, terutamanya bagi mengetahui tentang punca kematian.
Keadaan mayat sekalipun telah berubah akibat pembusukan, pemeriksaan postmortem tidak menghadapi sebarang masalah untuk menjalankan pemeriksaan.
Daripada pemeriksaan yang dijalankan, boleh doktor sahkan bahawa doktor dan Dr. Stu, pertama sekali kedua-dua doktor dan Dr. Stu bersama-sama semasa proses ataupun semasa pemeriksaan dijalankan.
Benar.
Jadi doktor mengetahui segala yang berlaku ketika itu.
Benar.
Daripada pemeriksaan yang dijalankan, boleh sahkan bahawa doktor tidak menemui apa-apa yang luar biasa terhadap ataupun di disease body kecuali beberapa kecederaan-kecederaan yang telah dijelaskan.
Benar.
Dan boleh juga saya cadangkan ataupun saya cadangkan bahawa kecederaan-kecederaan yang didapati pada tubuh mayat si mati itu adalah selari ataupun konsisten dengan latar belakang di mana si mati dikatakan telah hilang di dalam hutan dan akhirnya mayatnya dijumpai dalam keadaan tidak berpakaian di dalam hutan. Adakah konsisten kecederaan itu dengan sejarah ataupun latar belakang?
Melalui lawatan yang kami telah jalankan di lokasi di mana mayat telah ditemui, saya berpendapat kecederaan pada si mati adalah konsisten dengan keadaan sekeliling di mana beliau dijumpai.
Dalam keterangan doktor juga, doktor mengatakan tak ada bukti ataupun keadaan jelas yang menunjukkan adanya tanda-tanda bahawa si mati ada bergelut, ada berlaku pergelutan daripada mana-mana bahagian yang diperiksa. Boleh terangkan keadaan?
Melalui pemeriksaan post-mortem, kami tidak dapati sebarang kecederaan yang menandakan si mangsa telah bergelut, terutamanya kecederaan seperti lebam di bahagian pergelangan tangan akibat contohnya ditarik, ataupun lebam di bahagian mana-mana tubuh badan akibat dipukul, dan juga tiada kecederaan luaran terutama di bahagian kemaluan.
Bahagian-bahagian muka, mulut dan sebagainya
juga tidak saya dapati sebarang kecederaan yang menandakan akibat keganasan.
Dalam kata lain, tidak ada bukti bahawa mangsa telah diserang ataupun cuba mempertahankan diri menyebabkan adanya kesan-kesan tanda sedemikian.
Tiada kecederaan yang menandakan akibat mempertahankan diri di dalam kes ini.
Berkenaan dengan keterangan doktor berkenaan subcutaneous tissue yang dikatakan ada hematoma on the right elbow measuring 3.3 cm dan ada lagi dua tu. Bagaimana penjelasan doktor berkenaan dengan kecederaan-kecederaan ini?
Kecederaan ini terletak pada bahagian di mana tulang tertonjol, atau mohon saya dalam bahasa Inggerisnya bony prominence, di mana jika kecederaan lebam terutamanya terdapat di kawasan-kawasan ini, kita boleh takrifkan sebagai akibat daripada hentakan ketiga terjatuh.
Contoh bahagian tu apa ni doktor?
Contoh bony prominence di badan kita adalah siku, lutut, dahi, belakang kepala, di mana bahagian-bahagian ini yang akan sentuh dulu di bahagian permukaan ketika terjatuh.
Ya doktor, saya pergi pada pemeriksaan di bahagian genitalia. Doktor mengatakan ataupun dalam pemeriksaan didapati hymen intact dan tiada kecederaan di bahagian luar genitalia yang dikesan mayat si mati. Boleh saya cadangkan bahawa setakat mana pemeriksaan yang telah doktor jalankan di bahagian genitalia mayat si mati tersebut, doktor tidak menemui apa-apa bukti forensik yang dapat menunjukkan bahawa si mati telah diserang secara seksual oleh mana-mana pihak ketiga sepanjang tempoh kehilangannya.
Melalui pemeriksaan genitalia, pemeriksaan luaran tidak mendapati sebarang kecederaan seperti lebam. Pemeriksaan juga mendapati hymen masih intact. Pemeriksaan juga dijalankan di bahagian dalam, tidak mendapati sebarang kesan kecederaan seperti lebam. Pemeriksaan juga telah diteruskan dengan mengambil sampel di bahagian luar kemaluan dan juga di bahagian dalam untuk pemeriksaan spermatozoa dan juga DNA asing. Melalui pemeriksaan ini boleh saya simpulkan bahawa tidak terdapat penetrasi kepada bahagian hymen, tetapi saya tidak boleh menafikan secara 100% sekiranya terdapat jari disentuh di bahagian tersebut, contohnya.
Cuma daripada apa yang dilihat, tidak ada sebarang serangan ataupun kesan-kesan kecederaan di bahagian itu yang boleh disimpulkan untuk pemeriksaan.
Melalui pemeriksaan saya berpendapat tiada keganasan di bahagian tersebut.
Berkenaan dengan keterangan
Teruskan.
Berkenaan dengan keterangan doktor berkenaan dengan keadaan perut ataupun stomak si mati yang dikatakan kosong. Dan apakah penjelasan doktor bagaimanakah keadaan itu boleh berlaku dari segi
Perut akan kosong jika satu, tidak terdapat sebarang makanan yang diambil untuk jangka waktu yang tertentu. Perut juga boleh kosong sekiranya seseorang itu muntah apa jua yang diambil ketika memakan.
Maksudnya dia tidak semestinya, kalau perut dia kosong, adakah tempoh tertentu baru kita boleh mengesan berapa lama keadaan itu?
Untuk perut dikosongkan bergantung satu kepada individu dan juga yang ini bergantung pada umur jantina, tetapi boleh dianggarkan secara umumnya perut tanpa makanan boleh kosong antara 8 jam dan ke atas.
Kalau dia tak ada muntah?
Jika tiada muntah.
Jika tiada muntah. Okay, berkenaan dengan keadaan si mati, kecederaan si mati, saya sekali lagi pergi kepada kecederaan yang dikesan pada tubuh si mati. Banyak kecederaan dilihat pada bahagian kaki, ada scratch dan sebagainya yang dijelaskan dalam nyata saksi doktor dan juga laporan post-mortem. Ada tak apa-apa kecederaan yang ditemui di bahagian telapak kaki?
Ada terdapat kecederaan pada telapak kaki.
Boleh doktor jelaskan penemuan?
Kecederaan telapak kaki merupakan bahagian di mana kulit di bahagian tapak kaki adalah sangat tebal. Jadi tapak kaki adalah kawasan di mana agak sukar untuk mendapat kecederaan daripada keadaan biasa. Di dalam kes ini terdapat kecederaan pada telapak kaki dan saya berpendapat kecederaan ini konsisten dengan sekiranya si mati berjalan tanpa kasut di bahagian hutan di mana beliau dijumpai.
Maknanya kalau dia tidak berjalan tak ada kasut sekalipun, jika dia tidak berkasut sekalipun, seperti kaki ayam di dalam hutan, sekiranya dia tidak memijak apa-apa bahagian yang sharp objek yang terlalu tajam dan sebagainya, dia tidak akan, tapak kaki tidak akan mengalami kecederaan yang begitu serius. Itu maksud doktor?
Benar. Kecederaan sekiranya si mati memijak objek yang tajam, maka saya berpendapat akan dapat kecederaan seperti incise wound di bahagian kaki. Tetapi di dalam kes ini hanya terdapat abrasion wound di mana saya berpendapat ia konsisten dengan objek seperti batu, kayu dan juga pasir.
Mungkin duri?
Duri boleh menyebabkan abrasion wound.
Kerana dalam kes ini adalah sebenarnya dikesan kecederaan di telapak kaki itu yang doktor kata konsisten dengan latar belakang dia tidak berkasut.
Benar.
Okay, berkenaan dengan sebab kematian. Boleh doktor jelaskan, jika doktor sebut tadi sebab kematian ataupun dalam laporan post-mortem, juga dalam keterangan doktor sebentar tadi, menunjukkan bahawa ataupun doktor kata cause of death is upper gastrointestinal bleeding due to duodenal ulcers complicated with perforation. Boleh doktor jelaskan dalam bahasa orang awam ataupun bahasa yang lebih mudah bagaimana kecederaan ini boleh berlaku dan yang membawa kepada kematian si mati?
Melalui pemeriksaan post-mortem, sebab kematian diberikan setelah mendapati terdapat ulcer ataupun ulcer berganda di bahagian duodenum. Duodenum adalah bahagian usus kecil selepas organ perut, di mana di bahagian dalam ataupun mukosa dinding duodenum ini terdapat ulcer yang di mana sebahagian daripada ulcer ini telah bocor. Bocor bermaksud dinding duodenum ataupun usus kecil ini telah tembus, di mana isi duodenum ataupun isi daripada perut boleh keluar daripada usus ini ke bahagian peritoneum. Peritoneum adalah bahagian rongga di bahagian dalam perut. Okay. Sebahagian daripada ulcer ini sekalipun tidak bocor, ia telah menyebabkan, dalam bahasa Inggerisnya, erosion ataupun hakisan kepada dinding usus kecil ini. Dinding usus kecil ini mengandungi salur-salur darah, di mana jika hakisan berlaku menyebabkan kecederaan kepada salur-salur darah di dalam dinding usus ini, ia menyebabkan pendarahan. Pendarahan ini secara kolektifnya di dalam kes ini adalah sangat banyak, dan saya berpendapat ini boleh menyebabkan kesan ataupun secara mudahnya kematian kepada si mangsa. Jadi sebab kematian itulah diberikan sebagai upper gastrointestinal bleeding due to duodenal ulcer complicated with perforation.
Atau ada apa-apa lagi yang doktor nak tambah berkenaan dengan pemeriksaan yang dijalankan daripada keterangan doktor ataupun daripada laporan post-mortem yang sediakan? Ada penambahan ataupun perpindahan dan sebagainya doktor nak buat?
Tiada.
Itu saja soalan saya, Puan, setakat ini.
Okey, terima kasih Tuan. Sir Sakti ataupun Miss Louise? Ya. Oh, laporan. Kita tanda dulu laporan.
Ya.
Exhibit berapa? ER76.
Dengan izin Puan, dengar?
Dengar tak doktor?
Puan dengar atau tak dengar? Puan dengar sekarang?
Ya, dengar.
Puan, sebelum saya tanya, memandangkan intipati keterangan Dr. Hanif adalah di dalam bahasa Inggeris, I'm wondering whether Puan boleh berikan kebenaran kepada pihak kami untuk bertanya dalam bahasa Inggeris. I know
tak ada masalah. Boleh.
Boleh ya? Terima kasih. Dan Puan, in that case, Puan Louise akan tanya soalan. Thank you.
Akan saya
Dengar dia cakap. Saya tak tahu, saya tak dengar apa tiba-tiba cakap.
Tak dengar.
Sama saya. Mula-mula dengar, lepas tu dia saya.
Dr. Hanif, a few questions, if I may, on behalf of the family in this case.
Okay.
First of all, Dr. Hanif, you've told us about the cause of death in this case.
Correct.
Which medically is straightforward, upper gastrointestinal bleeding due to duodenal ulcers complicated with perforation.
Correct.
The challenge in this case, both for yourself and your colleague, as well as for Puan Koroner, is determining in what circumstances that death occurred. So medically straightforward, but perhaps evidentially in terms of determining exactly how that came about, much more complicated. Would you agree?
Sorry, I couldn't get the question.
So I'm just suggesting to you, Doctor, that the cause of death medically is relatively straightforward for you. You were able to determine that quite clearly after the examination. However, the exact circumstances in which Nora came about her death is more of a challenge.
Correct. In this case, we've done the postmortem for a length of time. As documented that we started the postmortem around 11:45 in the morning, and we ended the postmortem examination at 8:45 p.m. So we took into consideration every points, every suggestion or every possibilities to rule out any violence, any sexual assault possibilities. But after a while, we couldn't find any obvious or any strong findings that can suggest other ideas or other possibilities. And when we examine the organs, we examine internally, and we found out that the ulcers, it's obvious in this case, which definitely we cannot miss out. And also the bleeding is quite massive. And for us, the cause of death, of course, is straightforward, but the circumstances surrounding, of course, it's not for us to judge.
But Doctor, you can help us a little with some of the circumstances surrounding. There's two questions, isn't there? First, medically, the cause of death, which obviously you have helped us with and has been established. But the other aspect is the surrounding circumstances. I'm just going to seek your indulgence to explore a little bit some of the surrounding circumstances that led to Noran's death. Let's deal first with this issue of whether a third party could possibly have been involved in the death. You, as you say, you carried out a very lengthy and extensive examination of Noran's body. You didn't see any signs of any bruising that would indicate a sexual assault. That's right, isn't it?
Correct. Yeah.
And the hymen was intact. That's correct.
Correct.
And so from that, we know we can perhaps say that there was no violent sexual assault.
Correct.
But sexual assaults take different forms. That would be right.
As I explained to prosecutor just now.
Yes.
There's no violence towards the genitalia area. But of course, we couldn't exclude whether there is a touch or any contact from anyone to the area.
Yes. So you couldn't exclude the possibility that some kind of sexual assault took place in that full length of 10 days in which Noran was missing.
We can exclude the violence around the area, but not to exclude the sexual approach to this case, to the disease as well.
Yeah. And things that you might expect to find if a third party was involved in the death might include, for instance, you took swabs from under Noran's fingernails to look for DNA evidence. That's
correct.
Right.
Yes.
But we know in this case that she'd been laying in a stream on your analysis from either 2 or 3 days at least, and there were washerwoman's signs to her hands and feet.
Correct. Yeah.
So it would be unlikely, therefore, that we would get any DNA evidence from underneath her fingernails, you might think.
Correct. There's always the limitation on doing tests on a body that has been died for a few days.
Yes.
In this case, I would say the circumstances is that there's no violence to the body, but you cannot exclude whether the deceased has been placed on the area by her own and left by her own to survive.
So you couldn't exclude that as a possibility, that within those 10 days at some point she might have been held by somebody or interfered with in some way by a third party. You couldn't exclude that on the basis of your
Correct. We
examination.
cannot exclude that.
And things like hair transfer, fibers from clothing, if a body's been lain out for 2 or 3 days, you would expect perhaps that they might be washed away or discarded. You wouldn't necessarily expect to find evidence like that.
Correct.
And in addition, you've told us that there were no obvious signs of a struggle on the body, because for some victims, obviously, if somebody tries to sexually assault you, you might resist, you might seek to defend yourself, and that might leave marks.
I agree.
But where a victim was particularly suggestible or particularly compliant, and I think you had a conversation with Mrs. Quoirin the second time that she came to identify her daughter, where she explained that Nora was particularly submissive child. Would that be right?
I agree. If there's no, if the victim actually followed the perpetrator, there won't be any suggestive of violence as per any bruises, for example. You won't find anything on the deceased. I agree.
And I mean, let's suppose for a moment, for instance, that if Nora was in some way sexually assaulted, for example, on day 1, again, just the passage of time, so the fact that she wasn't found for 10 days would also render any positive findings much more difficult.
Correct. For example, the spermatozoa sampling. If someone had, for example, discharge into the area, genitalia area, for example, or on the body, after many days, with washing or with raining, for example, all the evidence will wash away.
Doctor, just want to get your assistance with whether we can be any clearer on 2 further aspects in this case. First is the likely time of death, and second is to what extent we can determine how much Nora had been moving within the jungle in the days leading up to her death. In respect of pinpointing the time of death, you were assisted by the entomology report, which said that from the time of gathering the maggots from the body, it would appear that Nora had been deceased for 4 days. So that would put us on the 10th of August.
The problem with estimating time of death based on post-mortem examination, there's always limitation because the body itself change depending of many factors. For example, the temperature within the area and the activity of the disease while she was dying, for example. We conclude our time of death slowly based on post-mortem examination. So that's why we took entomology samples to further pinpoint the time of death. However, I couldn't explain the finding of entomologists at this time. The entomologist would be the one have better explanation in this case.
So sorry, doctor, doing the best that you can then, is your conclusion that you think Nora had deceased either 2 or 3 days before before you did the examination on the body?
So initially when I viewed the body at scene, I gave the estimated time of death is more than 36 hours. But later on, when we did the post-mortem in better lighting in the post-mortem room, we further conclude that the time of death is within 3 to 4 days.
3 to 4
So
days.
again, the examination is again based on the post-mortem changes and has been going on the body with better lighting.
So then does that put us then at the 9th or 10th of August as the likely day that Nora passed away?
For us, yes.
Yes. Just to ask for your input on some of the evidence that we've had thus far about that particular location where Nora was found. We know on the 7th of August that that location was searched. That on the 8th of August, that location was searched, and one officer said he actually went physically down to that stream, to that point where Nora was found. Of course, she wasn't there. And then on the 9th of August, the Tiger platoon went into that area and searched again so that they could go into the more challenging areas. And on the 9th, there was a search, there was a 1 kilometer radius at least surrounding that area. And on the other side, a 2 kilometer area minimally was searched. And there was no signs of Nora. So on your analysis, that would have been very close to the time of death. How much do you think she would have been moving around that time, bearing in mind what we know of her, which was that she was already quite physically challenged. She had a disability that made it difficult for her to balance, to move quickly. And also by that point, she, as we know from your examination as to the cause of death, she would have been starving and perhaps also, doctor, seeing the effects of the ulcer.
For me, it's not my expertise to really suggest to you why she was not found during the time, during the search. For me, it's either it's either she was missed by the search team, or again, like you said, it's possible if someone put her in that area later on, which in my opinion is based on investigation. It's difficult to suggest or difficult to give answer in these circumstances.
Also, doctor, as a lay person, as somebody who, a non-medical person, when you look into issues like dehydration, typically it's said that somebody survives for about 3 days without water. And most people, of course, who go missing in the jungle do so in different circumstances to Nora, so clothed and with perhaps some provisions with them. They get separated from hiking groups. I don't know if you also had sight of the British Post-Mortem report that said that Nora was in condition. Did you have an opportunity to look at the report at all? Or? I don't know if that was shared with you, doctor. We had a British pathologist who had a look at the position.
I couldn't get the question, but
sorry,
in my opinion,
just to ask, did you at any point have sight of the report that was done by a UK pathologist?
Yeah, I read the I would say the presentation was made by UK pathologists during the inquest last week.
Yeah.
So I get the idea about the post-mortem and the findings that was done by the pathologist.
Because he commented that Nora would have been susceptible to dehydration because of the hollow prosencephaly.
I don't have any comment on that because personally, of course, it's individual. Again, different individual has different needs, different kind of body have different needs. In this case, Nora was found near a water stream. So in a way, the area should be having a plenty of water. So for her, to say dehydration play a big part is bit difficult. Not mean difficult, but because of human nature, we always looking for water whenever we feel thirsty. And that's why we can explain why she was found near the water, because of she needs some, the fluid itself.
Because the search was very much located around water for the same reason. You couldn't discount the possibility, however, that perhaps someone had given her water in those days leading up to her death.
Correct. We cannot discount that as well.
In terms of the marks on Nora's body, it's clear that she did have a number of abrasions consistent with moving through the jungle for some time. However, it wouldn't be possible, would it, to know whether they were consistent with her moving through the jungle for 2 days or 5 days or 7 days?
One is difficult to estimate. I mean, it's difficult to tell the time or estimate the injury date in this case, because she has a multiple abrasion wound all over the body. Some look fresher than the rest, and some was damaged by ant bites, for example, by maggots. So you can't really gauge, or you can't really explain how long the abrasion has been done. But all I can say is all the abrasion on her body is on varying stages of time.
But you couldn't give a more precise estimate as to what period of time?
Correct. It's difficult to be precise, especially in this case.
And particularly the subcutaneous injuries, the bruises, are notoriously difficult to age in anybody, as I understand it. You can have some estimate based on discoloration, but it's always difficult to age those subcutaneous bruises.
Correct. The subcutaneous injuries, mostly bruises, it's difficult to age. One thing is similar in colors. All the subcutaneous injury is similar in colors. The other thing is because of post-mortem changes, and the bruises, the blood cells in the bruises has been broken down by post-mortem. So it's difficult. Even we did what we call as histopathology examination. We took sample from the bruising area and look under microscope to see any other findings suggestive of timing. For example, if you get bruises, sometimes you get inflammatory cells within the area to show you the time, which can suggest a time after the bruise happened. In a way, because our body keep on healing any injuries, so when you have injury on that part of area, you can see some inflammatory cells trying to clear up the area. But in this case, because of post-mortem changes, because of the breaking down due to the post-mortem process, so you cannot see any of those findings under histopathology examination. So to answer, I agree that it's very difficult to precisely time when the bruises happen in this case.
And those 3 bruises, Doctor, could they be, you hypothesize that could be the result of a fall. Could it be 1 fall rather than three falls?
It's difficult to say. It's depend. One person can have a fall and injure different part of the body.
So it's possible that she could have fallen, injured her shoulder and her elbow and knee all as a result of the same fall.
Yes, she can have it in 1 fall, or she can have it in 3 falls.
And we know that she had a lot of problems with her balance. Both her mother and head teacher have given evidence as to that effect. Just to confirm, there's no evidence of a serious fall, in the sense there was no bony injuries or no large areas of bruising.
Yes, from the post-mortem examination as well as from radiographic whole body x-rays, we couldn't find any obvious fractures in this case.
Doctor, just one very small thing to clarify, if I may. You did a test on Nora that related to, I've lost the precise, is it a diatom test?
Diatom test, yes.
Can I just confirm that relates, what you're looking for there is whether it's possible that she drowned. You're not looking as to whether she drank local water.
In this case, we look in every angle because she was found near the water stream. I understand it's part of her body immersed in the water. As my experience, even shallow water can cause drowning, especially in children or in disabled. So in this case, we look for possibilities of drowning. From the test, the diatom test that we've done, there's no correlation between diatoms found in the organs of the body, which is not the same as the one that found in the water sample from the stream.
So just to be clear, does that help us with any way regarding the question of whether she might have drank local from any streams, or is it something entirely separate?
Diatom test is a test that can support drowning cases, but it's not a test to actually determine the cause of that. So in this case, we didn't find any suggestion of drowning findings. The diatom test just to make sure if we found drowning changes or drowning findings on the body, we can correlate the test.
I see. Thank you very much, Doctor. Thank you for your time.
Thank you. No problem.
Cik Alif?
Sorry Puan, baru dengar. Okay, Doktor, saya adalah peguam mewakili resort dari dusun ni. Saya just ada beberapa soalan untuk mengesahkan beberapa perkara yang doktor telah beri keterangan tadi ya.
Okay.
Okay, kalau tak dengar suara saya ataupun tak faham soalan saya, sila nyatakan dan saya akan ulang balik soalan tu.
Boleh.
Okey, doktor, untuk kes ni ataupun penglibatan doktor dalam kes ni, boleh tak doktor sahkan yang skop pelibatan doktor adalah untuk menjalankan post-mortem dan menentukan sebab kematian si mati.
Benar.
Benar ya. Dan berdasarkan kelayakan, pendidikan dan juga skop pelibatan doktor dalam kes ni adalah bukan tugas doktor untuk membuat sebarang siasatan tentang bagaimana si mati boleh macam mana ataupun si mati boleh terlantar di kawasan di mana beliau terjumpa.
Benar.
Benar ya. Jadi saya juga nak tanya ya, boleh tak doktor sahkan bahawa sebarang siasatan tentang kemungkinan si mati dicolek ataupun penglibatan pihak ketiga melainkan perkara-perkara yang boleh dibuktikan melalui post-mortem secara medikal itu adalah di luar skop penglibatan ataupun bidang kuasa doktor.
Setiap kali arahan post-mortem dikeluarkan, kami sebagai doktor yang melakukan post-mortem akan diberitahu tentang latar belakang kejadian. Jadi berdasarkan kemungkinan berdasarkan latar belakang kejadian, kami memeriksa mayat, mengambil kira keadaan-keadaan tersebut. Jadi di dalam kes ini kami periksa dan kami rule out kebanyakan sangkaan yang diutarakan sama ada daripada pegawai penyiasat polis. Sekiranya semasa post-mortem kami dapati kesan-kesan keganasan ataupun kesan-kesan serangan seksual, secara tidak langsung kami membantu pihak polis untuk lebih terperinci memeriksa ataupun membuat siasatan terhadap kes tersebut.
Ya, jadi maksud saya penglibatan doktor adalah setakat apa yang dapat dijumpai semasa post-mortem sahaja, bukannya termasuk apa yang siasatan yang mungkin akan dibuat ataupun tidak dibuat oleh pihak polis.
Benar.
Tadi doktor pun cakap doktor ada jelaskan semasa DPP tanya tentang sebab kematiannya. So sekarang saya just nak tanya doktor, macam mana bagaimana ulcer tersebut boleh terjadi pada seseorang yang di dalam duodenum tadi tu. Macam mana, apa yang boleh menyebabkan ulcer tersebut terjadi?
Ulcer boleh disebabkan oleh beberapa perkara lah. Antaranya termasuklah stres pada badan sendiri. Kebanyakan ulcer dengan rawatan ia boleh sembuh. Tetapi jika tanpa rawatan ia boleh menyebabkan komplikasi pendarahan yang banyak. Ia juga boleh menyebabkan komplikasi kebocoran usus, di mana jika berlaku kebocoran usus boleh berlaku jangkitan pada bahagian perut ataupun kita panggil pleural cavity dalam bahasa Inggeris ataupun bahasa perubatan peritonitis, juga boleh menyebabkan kematian.
Dan saya nak tanya doktor, lanjutan daripada itu, ulcer ni dia boleh terjadi ataupun boleh wujud walau selepas 2-3 hari ataupun dalam satu jangka masa yang lama. Macam mana saya nak tahu?
Sukar untuk dikenal pasti, tetapi saya berpendapat sekiranya seorang itu telah menghidapi ulcer, kemudian dia mengalami kelaparan tanpa makanan di dalam perut, situasi ini akan mempercepatkan ataupun memburukkan keadaan ulcer tersebut.
Adakah ia akan mempercepatkan kejadian ulcer ataupun dia akan memburukkan ulcer yang sedia ada?
Ia boleh memburukkan keadaan ulcer yang ada.
Maksudnya ulcer tu is a pre-existing condition lah, memang dah ada.
Di dalam kes ini saya tidak boleh
Pasti.
tentukan sama ada dia telah ada ulcer sebelum atau selepas kejadian di mana beliau hilang.
Okey, itu saja doktor. Terima kasih.
Macam doktor agree dengan proposition yang soalan yang dikemukakan oleh peguam kaunsil kepada dusun yang mengatakan bahawa tugas doktor adalah membuat postmortem dan juga mencari sebab kematian.
Benar.
Okay. Jadi postmortem dijalankan untuk rule out beberapa possibility yang telah diterangkan, yang telah dibentangkan kepada doktor dengan Dr. Siulang. Mungkin doktor boleh share dengan pihak mahkamah dan semua pihak apa daripada taklimat yang diberi oleh ASP Rashid kepada doktor, okay, apakah possibility yang ada yang dibuat oleh pihak doktor dan Dr. Siu sebelum postmortem dijalankan?
Sebelum postmortem dijalankan, ada beberapa isu yang diutarakan. Antaranya si mati dicolik. Keduanya si mati dirogol. Ketiganya si mati kerana dijumpai di bahagian air, si mati lemas. Keempatnya si mati diletakkan di kawasan tersebut. Ditinggalkan, benar. Jadi melalui pemeriksaan postmortem, kami boleh bahasa Inggerisnya rule out perkara di mana berlaku keganasan kepada si mati, berlakunya keganasan seksual pada si mati, dan tidak berlaku, kita boleh rule out tiada lemas, keadaan lemas berlaku di dalam kes ini. Tetapi yang pastinya kami tidak boleh rule out si mati ditinggalkan di kawasan tersebut. Sebabnya kami juga mendapat tahu ada kemungkinan si mati ada possibility untuk mengikut orang yang tidak dikenali. Itu melalui wawancara bersama ibunya sebelum postmortem dijalankan.
Ada possibility si mati mengikut?
Ada possibility
orang ketiga
yang kami tidak boleh rule out.
Itu maklumat yang doktor dapat daripada wawancara ibu dia. Okey, so maknanya sebelum postmortem dibuat, selain daripada taklimat yang doktor terima daripada ASP Rashid, maknanya ada wawancara juga dilakukan oleh pihak doktor dan juga ahli keluarga.
Benar.
So siapa ahli keluarga yang terlibat dengan wawancara tersebut?
Ibu dan ayahnya.
Ibu dan ayah. Okey, kita pergi satu-satu. Apa ibu cakap? Apa yang diterangkan oleh ibu kepada doktor untuk latar belakang si mati?
Saya difahamkan oleh ibunya, si mati mempunyai masalah, masalah dari segi pembelajaran, I would say. Masalah untuk berdikari. Jadi saya difahamkan oleh ibu, si mati ini tidak boleh berdikari dengan sendirinya, even sehinggakan makanan perlu disediakan untuk si mati, dan si mati tidak boleh ke mana-mana tanpa ada teman. Jadi saya difahamkan si mati tidak boleh berjalan dengan sendirilah di dalam kes ini. Tetapi saya ada diberitahu bahawa pernah terjadi di mana si mati telah di-approach ataupun didatangi oleh individu dan si mati tidak memberikan sebarang reaksi sama ada menolak ataupun mengikut individu tersebut. Ini diberitahu oleh ibunya ketika itu. Jadi atas dasar itu kita cuba memeriksa daripada sisi tersebut juga.
Sebab macam doktor cakap tadi tidak menolak ada posibiliti si mati tu mengikut pihak ketiga kan.
Benar.
Maknanya doktor cakap benda tu daripada ibu dia. Tapi kalau daripada pandangan doktor sendiri, maknanya ibunya mengatakan bahawa ada kejadian di mana dia di-approach oleh orang lain dan dia tidak bergerak ataupun mengikut. So tu situ saya tak faham gitu.
Satu lagi daripada input polis, kerana saya diberitahu oleh pihak polis di mana berlaku anjing polis yang mengikut bau sehingga pada pintu utama saja. Kemudian bau itu hilang. So di situ ada kemungkinan sama ada dia dibawa masuk ke dalam sebarang kenderaan dan sebagainya untuk dibawa ke satu tempat yang lain.
Itu kemungkinan lah.
Kemungkinan.
Okay. So apa pula keterangan wawancara dengan bapa si mati?
Bapa si mati kebanyakan masa mengiyakan apa yang dikatakan oleh ibunya.
Wawancara dibuat bersama?
Bersama. Tidak diasingkan.
Okey. So maknanya pihak hospital, forensic pathologist rule out tak ada possibility yang asal iaitu penculikan, rogol, lemas atas dasar sebab tak ada satu bukti keganasan kepada body si mati atas alasan itulah.
Benar.
Okey. So sekarang daripada keterangan doktor hadir ke tempat di mana si Binti dijumpai pada 13 hari bulan itu sendiri dan juga selepas post-mortem dilakukan pada 16 hari bulan.
Benar.
Okay, mungkin doktor boleh terangkan kepada mahkamah apa tujuan 13 hari bulan Dr. Hadi?
13 hari bulan saya dijemput oleh ASP Rashid untuk hadir ke tempat kejadian. Antara peranan bila saya ke tempat kejadian, satu adalah untuk memastikan satu kematian telah berlaku, maksudnya individu tersebut telah meninggal dunia. Satu lagi untuk memeriksa mayat yang hadir, memeriksa mayat yang ada di tempat kejadian. Satu lagi untuk memastikan jika perlu sebarang sampel diambil di tempat kejadian. Dan juga untuk memastikan proses membungkus dan penghantaran mayat dilakukan dengan baik kerana ia boleh mempengaruhi bedah siasat kemudiannya. Sebab ada berlaku di mana mayat tidak diurus dengan betul, berlaku kecacatan ataupun kecederaan selepas kematian. Jadi ini boleh mempengaruhi dapatan semasa post-mortem. Jadi itu antara tugas-tugas kami semasa melawat di tempat kejadian.
Okey, dan semua tugas-tugas itu sudah dilakukan oleh doktor lah, termasuk mengambil sampel-sampel di tempat di mana mayat dijumpai lah.
Jika perlu.
So adakah diambil sampel pada ketika itu?
Di dalam kes ini kami tidak mengambil sebarang sampel pada mayat si mati. Tapi bahagian forensik polis ada mengambil beberapa sampel.
Okey. So maknanya dia tidak melibatkan pihak doktor sendiri untuk pada ketika itu 13 hari bulan, maknanya doktor adakah termasuk maknanya untuk menilai situasi sekeliling di mana mayat dijumpai?
Saya mengambil peluang ketika itu untuk menganalisa tempat kejadian, terutamanya sungai yang kecil itu. Semasa saya hadir di tempat kejadian, mayat telah dialihkan ke atas plastik hitam lah. Jadi saya juga mengambil kira menganalisi kawasan tersebut dan juga perjalanan ke arah kawasan tersebut, di mana saya dapati terdapat banyak pokok-pokok dan jurang yang curam untuk tiba ke kawasan tersebut.
Banyak pokok, boleh mungkin doktor boleh explain lebih detail berkenaan dengan suasana di situ?
Maksud saya pokok-pokok yang sukar untuk dilalui, sekiranya kita melalui kawasan tersebut, bahagian dahan ataupun ranting-ranting pada pokok tersebut akan mengguris kulit badan kita lah.
Okey. Bagaimana pula dengan kehadiran doktor dengan Dr. Siu pada 16 hari bulan? Tujuannya pula?
Tujuan untuk pada 16 hari bulan sekali lagi lawatan dilakukan bersama-sama Dr. Siu untuk mendapat lebih mendalam terutama kecederaan pada tapak kaki.
Okey.
Ya, sebab semasa pemeriksaan kita dapati ada kecederaan pada tapak kaki tetapi tidak terlalu banyak. Jadi kami pergi ke tempat kejadian tersebut untuk kembali memeriksa keadaan di tanah lah. Dan kami berpendapat kecederaan tersebut masih konsisten dengan kejadian dengan keadaan tempat kejadian.
Mana tapak kecederaan tapak kaki tu walaupun trivial macam tak berapa banyak, kalau kita tengok pada keadaan tu memang sukar nak jalan tapi dia still konsisten dengan kecederaan yang dialami oleh si mati.
Benar.
Okey. Baik. Okey. Tadi Cik Alif ada tanya tentang peptic ulcer. Okey, peptic ulcer dan Cik Alif ada tanya antara faktor-faktor yang menyebabkan peptic ulcer ni dan doktor menjawab ialah salah satunya ialah stres. Okey. Daripada wawancara dengan ibu bapa sendiri doktor, ada tak masa tu ialah selepas peptic ulcer masa tu tak tahu lagi dia ada mengalami peptic ulcer tak? Jadi masa wawancara ada tak pertanyaan ataupun maklumat didapati berkenaan dengan kesihatan ataupun any medication diambil oleh si mati ni daripada keluarga?
Melalui wawancara tersebut, selain dari apa yang diberitahu sebelum ini iaitu masalah pembelajaran dan juga berdikari, tiada masalah kesihatan lain.
Masalah anxiety ke apa semua dia tak ada,
tiada.
Alright.
Tiada dan juga tiada ubat yang dimakan.
Tiada ubat yang dimakan. Okey. Maknanya selain daripada masalah dia ada beritahu tentang masalah holoprosencephaly?
Ada diberitahu.
So selain daripada that HPE, ada tak maknanya dia tak ada masalah kesihatan lain lah?
Tiada.
Okey. So kalau tak ada masalah kesihatan lain, berbalik kepada soalan Cik Alif tadi, maknanya peptic ulcer ni macam maknanya ada kemungkinan dia boleh jadi maknanya dalam a short period of time.
Boleh
jadi a short period of time. Adakah okey, katakan seseorang yang tidak ada existing ulcer. And then existing ulcer, apa antara faktor yang boleh menyebabkan dia mendapat that kind of peptic ulcer dalam masa a short period of time? And then dia tak ada latar belakang medical pun.
Ia juga boleh disebabkan oleh jangkitan lah. Antaranya yang terkenal ialah H. pylori, jangkitan H. pylori. Tapi itu tidak boleh dibuktikan kerana proses pembusukan telah berlaku.
Okey.
Dan juga stres tanpa makanan juga boleh menyebabkan ia berlaku dalam masa yang sangat cepat.
That's bacteria tu memang kita kalau misalkan decomposition tak berlaku, maknanya boleh dapat daripada that stomach, daripada abdomen stomach tu sendiri ke macam mana?
Semua peptic ulcer jika di hospital, sampel akan diambil untuk memeriksa ada jangkitan H. pylori atau tidak.
Okay.
Jadi ia boleh dikenal pasti.
Yang ni kita tak dapat lakukan sebab masalah di autolyse.
Benar.
Okay, right. So sambung tu. Then selain pada tu?
Yang boleh menyebabkan ulcer.
Yes.
Yang saya pasti adalah stres dan jangkitan lah. Itu yang paling utama.
Maknanya dua lah. Stres
dan juga ubat-ubatan.
Ubat-ubatan. So dalam kes ni sebab
Tiada
tiada
ubat.
maklumat berkenaan ubatan, maknanya ada dua kemungkinan, that's bakteria. So bakteria H. pylori itu selalunya berpunca dari situasi ni lah kan? Secara general.
Secara generalnya ia adalah penyakit jangkitan di rumah. Daripada pengambilan air contohnya. Saya tidak berpendapat dalam kes ini jika ia berlaku semasa beliau hilang adalah akibat jangkitan H. pylori yang didapati di dalam hutan atau sungai tersebut. Saya tidak berpendapat begitu.
Okay. Alright. So so setelah maknanya doktor dan Dr. Siu consider semua possibility termasuk ada criminal element kepada budak ini untuk menentukan sebab-sebab kematian, dan upon post-mortem maknanya the obvious cause of death adalah disebabkan oleh peptic ulcer ni lah.
Benar.
Okay. Alright. Okey, PPN ada Tuan? Ada apa-apa nak soalan tambah?
Ya, saya ada beberapa soalan tapi sebenarnya kebanyakan soalan yang saya bercadang untuk bertanya pada peringkat ini telah pun ditanya oleh Encik Alif dan juga Puan Koroner sendiri. Namun begitu ada beberapa penjelasan yang saya ingin dapatkan daripada doktor. Banyak soalan-soalan berkenaan yang ditanya oleh peguam tadi adalah berkaitan dengan andaian-andaian. Andaian begitu, jika begitu dan jika begini. Adakah tugas doktor untuk bersetuju atau tidak bersetuju berkenaan dengan andaian-andaian tersebut? Sebenarnya tugas doktor sebenarnya untuk apa?
Untuk melakukan post-mortem dan juga mengeluarkan sebab kematian. Jika mampu kita akan cuba cari manner of death ataupun bagaimana ia menemui kematian tersebut.
Ya, maksud saya tadi, sebab itulah soalan saya itu kerana banyak ditanyakan sekiranya dia ikut kan, benda-benda yang tidak berada dalam daripada pemeriksaan, doktor sendiri tak boleh nak sahkan, betul?
Benar, ia perlu dilakukan oleh siasatan polis.
Siasatan polis. Sama jugalah dari semua sudut lah, maksudnya serangan yang dikatakan doktor kata tak boleh nak exclude jika ada disentuh ataupun dia ikut ada dia letakkan di situ dan sebagainya, doktor tidak boleh mengesahkan perkara.
Benar, saya tidak boleh sahkan.
Dan tugas doktor adalah untuk melihat sama ada membuat penilaian, sama ada unsur surveillance, pengelutan dan juga untuk mengetahui punca kematian semati. Itu sahaja yang sebenarnya tugas yang diminta untuk doktor lakukan.
Benar.
Cuma ada satu isu, kalau dia hilang berkenaan dengan soalan, dia dikatakan hilang pada 4 bulan 8. Kalau dia tidak ada makanan sepanjang tempoh daripada 4 hari bulan hingga kepada tempoh beliau ataupun si mati dikatakan meninggal lebih kurang 3 hari. Kalau 13 hari bulan ditemui lebih kurang pada 10 hari bulan. Dalam tempoh 6 hari, 6-7 hari. Jika si mati tidak ada sebarang makanan dan kemudian menyebabkan dia hanya bergantung barangkali kepada air dan menjadi terlalu lemah dan akhirnya dia sampai di sana tidak mampu lagi bergerak dan meninggal dunia di sana.
Lagi sekali ia bergantung kepada individu, keperluan individu berbeza. Kebanyakan manusia boleh hidup lebih lama tanpa makanan berbanding tanpa air.
Sebab soalan saya itu bergantung kerana ada soalan berkenaan dengan kemungkinan berlaku dehydration.
Jika tanpa ada ulcer dan juga tanpa makanan, saya berpendapat dia boleh survive ataupun boleh survive lebih lama.
Lebih kurang?
Bergantung kepada individu.
Ketahanan diri dia.
Ketahanan diri.
Jadi berdasarkan kepada penemuan, ia konsisten. Kemungkinan dia stres, tidak ada makanan dan menyebabkan datangnya, kalaulah dikatakan seperti yang Puan Koroner kata, dia tak ada pun ada ulcer hingga awal. Tapi adakah apa yang dilalui sepanjang tempoh kehilangan, kalau dia berjalan seorang diri di dalam hutan tanpa makanan dan sebagainya, akan menyebabkan wujudnya penyakit ataupun yang dikatakan sebagai ulcer tadi yang akhirnya membawa kepada kematian.
Benar.
Tentang kemampuan ataupun si mati yang dikatakan macam mana dia dengan orang, dia boleh ikut orang dan sebagainya. Ada tak doktor dia beritahu oleh keluarga si mati bahawa si mati ni sebenarnya takut kat orang. Dia tak akan ikut sebarang orang. Stranger terutamanya.
Secara spesifik saya tidak ingat.
Tak ingat. Tapi doktor tak ingat sama ada sebenarnya si mati ni seorang yang kanak-kanak yang takut kepada stranger, tidak mudah untuk ikut stranger. Ada perkara itu diberitahu oleh mana-mana keluarga si mati. Sebab apa yang difahamkan tadi, ia seolah-olah si mati ni mudah ikut.
Saya membuat andaian dia ada possibility untuk ikut berdasarkan tiada reaksi. Jadi itu hanya andaian saja.
Tapi tidak ada secara spesifik diberitahu sebenarnya dia ni sebenarnya tak boleh ataupun tidak biasa dengan orang yang dia tak biasa, dia tak akan ikut.
Seingat saya tidak diberitahu secara spesifik sama ada dia akan ikut atau tidak.
Berkenaan dengan lawatan doktor di tempat kejadian, soalan ahli saya iaitu untuk melihat tentang kesan tapak kaki kerana ada isu dikatakan tak ada nampak apa-apa kecederaan. Tapi apa conclusion ataupun kesimpulan yang dapat dibuat dalam keadaan badan si mati ataupun kakinya berada di dalam air dan dia walaupun dia ada kecederaan dan sebagainya, tetapi daripada pandangan orang biasa, adakah sebenarnya kita tak akan nampak dah kecederaan di tapak kaki itu kerana keadaan mayat yang telah berada dalam air.
Sekiranya
kecederaan yang jelas lah.
Sekiranya anggota badan berada di dalam air, kecederaan ini masih boleh dilihat, tiada masalah. Dalam kes ini ia tidak menghalang untuk kami untuk memeriksa kecederaan pada kaki dan kami mendapat kecederaan tersebut ada di tapak kaki.
Ada. Tapi mungkin orang yang tak tahu mungkin tak boleh nak bezakan. Kalau orang biasa lah tengok tapak kaki ni, tak ada apa-apa pun tapak kaki ni. Mungkin. Itu daripada pandangan orang biasa. Tapi kalau pandangan doktor masih boleh mengesan.
Boleh.
Kecederaan di tapak kaki dan ia memang berlaku dalam kes ni.
Kecederaan di tapak kaki di dalam kes ini adalah jelas.
Jelas. Dan memang konsisten dengan latar belakang beliau si mati tidak berkasut.
Benar. Kerana kami juga membuat pemeriksaan di tapak kaki ini dengan memotong kulit di tapak kaki lah untuk melihat di bahagian dalam juga.
Terima kasih doktor.
Sama-sama.
No, alright.
Terima kasih doktor. Terima kasih kepada saksi dilepaskan dan dilepaskan.
Puan, saya pun tangguh sebentar.
Untuk next Dr. Siu kan?
Not the end of this.
Alright. So kita tangguh sebentar.
Dengan izin Puan, pihak-pihak seperti tadi, kami bersedia untuk memanggil saksi inkuest yang seterusnya, Dr. Siu. Saksi yang ke-43. Dr. Siu Feng.
I, Siu Feng, do solemnly, sincerely, and truly declare and affirm that the evidence which I shall give in this case shall be the truth, the whole truth, and nothing but the truth. Thank you.
What is your age now?
50.
50.
50.
Is your current address as per IC?
Yes.
What is your current designation and where you're working now?
I'm working in the hospital Kuala Lumpur as a forensic medicine specialist.
Dengan izin Puan, Dr. Siu. Dr. Siu, my name is Ahmad Sazali bin Omar. I'm the Deputy Public Prosecutor. I'm asking you a few questions. But before that, Puan, untuk saksi ini juga nyata saksi telah pun disediakan oleh saksi ini dan pohon untuk saksi merujuk kepada penyata saksi.
Okay, you may proceed, Doctor.
Yes.
You may proceed to read your witness statement, Doctor.
Yes. Puan Koroner, I proceed. I am attached to Department of Forensic Medicine, Kuala Lumpur Hospital. I have passed my MBBS examination in September 1996 and obtained a degree in MBBS from Manipal Academy of Higher Education, India in 1997. I was a houseman in Kuala Lumpur Hospital from 1997 to 1998. I was posted as a medical officer in Cebu Hospital from 1998 to 2000. I pursued my postgraduate studies from 2000 to 2004 and obtained my Master of Medical Pathology Forensic in May 2004 from National University of Malaysia. I've been working in the Department of Forensic Medicine, Kuala Lumpur Hospital since 2004. I have completed my subspecialty training in clinical forensic medicine from January 2009 to January 2010 at Heraklion University General Hospital, Crete, Greece. My current position is forensic medicine consultant. The following are the main courses which I have attended. 17 to 18 September 2020, Medical Legal Skill Course, Shah Alam Hospital.
Doctor, you may skip paragraph 8.
Yes. Paragraph 9. I am a panel member of the National Confidential Inquiry into Maternal Death, Ministry of Health, Malaysia. I am a technical committee member of the Custody Medicine Unit, Ministry of Health, Malaysia. I'm a member of the National COVID Mortality Review Committee, Ministry of Health, Malaysia. I'm panel member of the Maternal Death Investigation and Under 5 Death Investigation, Department of Health, Wilayah Persekutuan Kuala Lumpur and Putrajaya. I'm a council member, treasurer of the College of Pathologists, Academy of Medicine of Malaysia. My main responsibility is to perform post-mortem and clinical forensic examination upon request by investigating officers I was on duty on the 14th August 2019. I performed a post-mortem examination on the body of a teenager girl named Nora Quoirin together with Dr. Hanif bin Mahmoud. The post-mortem examination was requested by ASP Rashid bin Qasim G/13127. The post-mortem examination was conducted on the 14th August 2019 at 11:45 a.m. in the mortuary of Tuanku Jafar Hospital, Seremban. The body was identified by ASP Rashid bin Qasim. We have conducted an external examination followed by an internal examination. We have also collected the specimen from the deceased during post-mortem examination. The body was already in a stage of early to moderate decomposition, characterized by foul-smelling, generalized peeling of skin, hair, and marbling. Maggot infestation was also seen with rupture of broad eyes. The following were noted on external examination. Height was 149 centimeters. The weight was 35 kilo. Abrasion were noted on the chest, refer marks of injury later. The deceased person was average build. She had fair hygiene. She had long brunette hair measuring around 40 centimeters in length. Her both eyes were already ruptured. Conjunctiva were peeled. Post-mortem skin changes and damages can be seen on her face. The right side outer forehead, middle forehead, left side forehead near the left eyebrow. Her mouth and nose were infested by maggots. She had natural dentation. There was no bleeding or discharge seen in the ears. The skin of her hands were wrinkles. And all the fingers also have the wrinkled skin. She had medium length trim nail. She also had skin wrinkles on both feet, abrasion wound, which you refer in the marks of injury later on. External genitalia show a female. Hymen was intact despite of decomposition and maggot infestation. There was no significant abnormality noted in the anus. Her body felt cold. But rigor mortis has already passed during the postmortem, and the postmortem hypothesis was diffused. There were ant bites marks seen on the chest, abdomen, all four limbs, and pelvic area. She had generalized skin peeling over the body. The following marks of injury were found on her body: right abdomen abrasion, 12 × 10 centimeter. Right lower abdomen abrasion, 6 × 5 centimeter. Right flank abrasion, 16 × 10 centimeter. Left chest abrasion, 13 × 6 centimeter. Left upper abdomen abrasion, 12 × 3 centimeter. Left lower abdomen abrasion, 18 × 3 centimeter. Mid abdomen linear abrasion, 3.5 centimeter, 10 centimeter above the umbilicus. Left back abrasion, 10 × 6 centimeter. Right buttock abrasion, 6 × 6 centimeter. Right shoulder abrasion, 10 × 7 centimeter. Right upper arm posterior lateral aspect abrasion, 13 × 5 centimeter. Right forearm abrasion, 4 × 2 centimeter. Right elbow bruise, 3 × 3 centimeter. Dorsal right hand abrasion, 2 × 1 centimeter. Right forefinger bruise, 2 × 1 centimeter. Fingers wrapped between right thumb and index finger, a bruise, measure 1 × 1 centimeter. Left upper arm anterior abrasion, measuring 14 × 7 centimeter. Left upper arm posterior abrasion, 19 × 7 centimeter. Right thigh abrasion, 35 × 19 centimeter. Right knee a bruise, measuring 9 × 9 centimeter. Right shin abrasion, 28 × 7 centimeter. Right foot dorsum abrasion, 10 × 5 centimeter. Right foot plantar abrasion, 7 × 5 centimeter. Right foot plantar lateral aspect abrasion, 3 × 0.2 centimeter. Mid right foot deep abrasion, 2.5 × 1 centimeter. Left thigh abrasions, 19 × Left thigh abrasion, 19 × 10 centimeter. left shin abrasion 9 times 5 centimeter, left foot heel abrasion 6 times 4 centimeter. Internal examination revealed the following. On examination of the head, the scalp, subgaleal hematoma over the right parietal region measuring 3 times 3 centimeter with concealed spirator temporalis muscle. There was no fracture of skull wall and the base of skull detected. The dural matter was intact and no extradural or subdural hemorrhage seen. The brain weighed 990 grams, no obvious malformation seen, tissue liquefaction at the base. On cut section of the brain, parenchyma was unremarkable and no hemorrhage seen. The circle of release was intact. Examination of the mouth, throat, and neck structure, there was no finding. The examination of the tongue was unremarkable. The thyroid was intact. The larynx was patent. Carotid was intact. No injury detected in the neck muscle, cervical muscle. There was no evidence of cervical fracture detected. No fracture of the higher bone, no fracture of the thyroid cartilage detected. Examination of the thorax, no rib fracture seen. There was no pleural adhesion or effusion seen. The trachea and air passages were intact and patent. Her right and left lung weighed 260 grams and 370 grams respectively. The lung surface was unremarkable and cut section revealed lung congestion. The pericardium was intact. Her heart weighed 150 grams. The epicardial surface was unremarkable. The coronary arteries were patent and arose normally from aorta. The foramen ovale was patent. The heart valves and cardiac chamber were unremarkable. The left ventricle thickness was 6 millimeters and the right ventricle thickness was 2 millimeters. No myocardial fibrosis seen. Her aorta was intact. There was no thromboembolism seen in the pulmonary artery. No reflux gastric content seen in the esophagus. On examination of the abdomen, the peritoneal cavity contained 550 ml of bile-stained fluid, mainly at the pelvic area. No collection of blood, pus, or slough. No retroperitoneal lesion seen. The stomach was empty and the mucosa was unremarkable. Intestine perforation noted at the anterior duodenum. Seal perforation at the posterior duodenum. There are of multiple and variant sizes of punctate out ulcer with rim of hemorrhage on the duodenal mucosa. Malignant stool at the distal small intestine. Malignant stool also seen along the length of the colon. The rectum contained malignant stool. Her lymph node were not enlarged. The liver was weighed 570 grams. Bile stain at the posterior inferior surface. The biliary system was patent. The pancreas already undergone autolytic changes. The spleen weighed 70 grams and was congested. There was no adrenal lesion or hemorrhage seen. The right and left kidney weighed 80 grams each. The cortical surface was smooth and cut section were congested. There was no significant abnormality detected in the urethras. There was no significant abnormality detected in the urine bladder. Bile stain at the outer superior surface noted on the urine bladder. The uterus was empty and weighed 50 grams. These are the findings on subcutaneous tissue on the following injury was seen on extensive subcutaneous dissection over the body and limbs. 1. Subcutaneous hematoma at the right elbow, measuring 3 times 3 centimeter. 2. Subcutaneous hematoma at the right upper back, measuring 3 times 2 centimeter. 3. Subcutaneous hematoma at the dorsum of right hand, measuring 2 times 1 centimeter. On examination of the skeletal system, there was no fracture detected from the post-mortem examination. No fracture seen from the skeletal survey radiograph. The following specimens were collected from the deceased during post-mortem examination for laboratory investigation. They're divided to 2 groups. The first is group A, sample taken for DNA analysis and trace evidence. comprising of 1. A1 hair, 2. pubic hair, 3. left breast swab, 4. right breast swab, 5. right side neck swab, 6. right side neck swab, 7. anal swab, 8. perianal swab, 9. pubic 1 swab, 10. pubic 2 swab, 11. oral swab, 12. left thigh swab, 13. right nail scraping, 14. left nail scraping, 15. low vaginal swab for spermatozoa and DNA analysis, 16. high vaginal swab for spermatozoa and DNA analysis, 17. blood on FDA card for DNA profiling, 18. bone for DNA profiling, 19. psoas muscle for DNA profiling. This is the first group of specimen. The second group of specimen, other specimen taken, including 1. liver tissue for toxicology, 2. peritoneal fluid for toxicology, 3. psoas muscle tissue for toxicology, 4. fecal occult blood, fecal matter for occult blood, 5. maggot for entomology examination, 6. selected tissue for histology examination, and 7. selected tissue and water sample from the scene for diatoms test. The results, the DNA result, A, DNA analysis, refer to the Jabatan Kimia Malaysia report with the laboratory number 19-FR-B-19139 dated 30th September 2019. This is the report from the chemistry department. The source of blood stain specimen is the biological child to the donor of blood specimen D, label May J. Josephine Quoirin, and E, label Sebastian Mary Phillips, and biological sibling to the donor of the blood specimen F, label Ines Julia, and G, label Maurice Arthur. 2. No DNA profile. No DNA profile was developed from the hair specimen V1, label Nora Iron Quoirin, blood stain on hair specimen V2, label Nora Iron Quoirin, and swab stick V13 and 14, label Nora Iron Quoirin. Swab stick 3B and 13B, swab stick V7, V8, V9, V15, and V16, all sperm cell and non-sperm cell extract, and V10 sperm cell extract, all labeled Nora Iron Quoirin. This is from the chemistry, just an extract from there. The second group is the toxicology. On 8 January 2020, a toxicology report was received from the investigating officer, laboratory number 19-FR-19364, dated 27 September 2019, liver V20, common drugs not detected, pesticide organophosphate organocholine not detected, psoas muscle V21, common drugs not detected, pesticide organophosphate organocholine not detected, peritoneal fluid V22, common drugs not detected, pesticide organophosphate organocholine not detected. A fecal occult blood test was positive. Refer to the laboratory number 057894448, dated 15 August 2019. Number 4 is an entomology report. Refer Institute of Medical Research, National Institute of Health report with reference number IPP/EF.075/2019. The medical entomology unit of the Institute for Medical Research received 2 bottles of specimen on the 16th August at 5:05 hours. The minimum post-mortem interval is based on the older stage, which is the 3rd Easter larva. The minimum age of the 3rd Easter larva is determined to be at least 4 days, implying the disease was dead at least 4 days prior to the collection of the larva from the cadaver. This is the abstract from the report from the IMR. Number E is a diatom test. Brain, lungs, kidney, spleen, bone marrow, and water from the scene was processed for diatom test. Examination show no comparable organism found in between the organs and water from the scene. Number 27 is the histology finding. Duodenum section shows some degree of autolysis. Duodenum section show extensive mucosa degeneration and widespread muscular mucosal disruption. Transmural disruption of duodenal layers also seen on the section. Food particles seen between the disrupted layer, Pearl stain was negative. Heart section shows some degree of autolysis, occasional myocyte, nuclear enlargement and hypericin, otherwise no fibrosis or hemorrhage. Section of the lungs shows some degree of autolysis. Pulmonary vessel appear congested, otherwise no significant pathology. Liver section shows some degree of autolysis, hepatocyte shrinkage seen surrounding center veins, otherwise no evidence of inflammatory cells infiltrate. The remaining tissue selected at post-mortem examination confirmed gross finding with some degree of autolysis and they did not demonstrate any further significant pathology. In summary of the post-mortem, the body was identified by ASP Rashid bin Qasim as the above named person prior to post-mortem examinations. Post-mortem examination revealed the body has undergone post-mortem changes. The estimated time of death based on the post-mortem changes is about 2 to 3 days, but less than 4 days. This is based on the post-mortem changes. Washerwoman sign was seen on both feet and hands, such as if these body parts were immersed in the water. Multiple injuries were found on the external examination. These injuries are not fatal in nature. These injuries were caused by friction with objects like tree branches, rocks, sands, etc., etc. The hymen of the deceased was intact despite of decomposition changes. No obvious injuries seen on external genitalia despite decomposition artifact. The dissection of the face, periorbital area, and lips show no obvious injuries suggest of smoothing. Extensive dissection of the skin done to examine the subcutaneous fat and the muscle for injury. No obvious grip marks or struggle marks seen on all limbs. However, there was a small bruises at the upper back of the right shoulder, right elbow, and right hand. This could be from a fall. Internal examination revealed 50 ml of dry fruit in the peritoneal cavity. Further examination found perforated duodenal ulcer with multiple punch-up ulcers, mainly in the first segment of the duodenum. There was massive amount of melena occluded in the large bowel and some occluded also seen in the small bowel. This occluded resulted from erosion of blood vessel of the above ulcers. In our opinion, the cause of death is upper gastrointestinal bleeding due to duodenal ulcer complicated with perforation. I need a rectification. This is our opinion, me and Dr. Hanif. Our opinions. Tissue toxicology analysis were negative. DNA analysis shows she was the biological child of Matt J. Joseph Quoirin and Sebastian Mary Phillips. She was also the biological siblings to Ines Julia and Maurice Otto. I have made a retrospective visit with Dr. Hanif and investigating officer on the 15th. May I make a correction? This is 16. 16 August 2019, after post-mortem examination for further understanding the circumstances of her death. Dr. Hanif bin Mahmud and I have prepared a post-mortem report as regard to these post-mortem examinations. Saya dengan ini mengaku bahawa segala keterangan yang saya berikan dalam pernyataan saksi ini adalah benar sepanjang pengetahuan dan kepercayaan saya. Terima kasih.
Puan, saya pohon nyata saksi ditandatangani.
saya suruh. Dah, kopi dia.
Yes. Today is 7, huh?
Today 7.
I correct some of the, can I correct some of the, yes. Thank you.
Yeah, Dr. Siu, I have a few questions. First, you said that you and Dr. Hanif have prepared a report as regard to the post-mortem examination performed by you and Dr. Hanif. Let me show you the report. You have the report? Can you confirm that this is the post-mortem report prepared by you and Dr. Hanif?
Yes, Puan Koroner, this is the post-mortem report prepared by Dr. Hanif and I.
Did you put your signature on this report?
Yes, my signature is on the page 11 of this report, the left-hand side.
Telah pun dikemukakan melalui Dr. Hanif sebentar tadi, Puan. Dr. Siu, is there anything that you want to add or you want to amend regarding this report?
Yes, Puan Koroner. Please allow me to amend page 5 of the post-mortem report under marks of injury number 25. Middle right foot deep abrasion 2.5 times 1 centimeter. There's a cm, centimeter. There's a cm here, which we didn't type a centimeter. And also, page 10 of the post-mortem report under summaries and conclusion, items number 10, blood toxicology analysis were negative. This is not a blood, it was a tissue toxicology. Tissue toxicology, not the blood. There's a typo error. It's a tissue toxicology analysis were negative. That's all.
About the amendment, did you consult or confirm with Dr. Hanif about this amendment?
Yes.
Before you take the stand just now?
Yes. Because there was no blood sample sent for toxicology. We sent only the tissue sample.
Yes.
Okay, doctor. In your evidence, you said that the body of the disease was already in the early stage of decomposition, right?
Yes.
My question is, how does this condition of, is there any effect, significant effect on your examination, due to the condition of the disease body?
Decomposition to have causing some changes on the examinations. However, the findings and the interpretation remain intact in this case, despite of the early to moderate decomposition. They have some changes on the body, but the findings and the interpretation remains the same.
Thus, may I suggest that the condition of the disease body did not affect your overall finding, especially on the cause of death of the disease?
Yes, in this particular case.
Dr. Siu, based on your overall finding as stated in your report, can you confirm that your examination on the body, from your examination, you did not find any unusual or abnormality on the disease body except for some injuries that you have explained in your reports?
What we found are the injury we described, the abrasion and the bruises and all. In addition, we couldn't find any others obvious injury.
Yeah. So, based on the injury also, may I suggest that the injuries on her body are consistent with the history or the facts that the disease was lost or missing in the jungle, and the body was later on found naked in the jungle? Is it consistent with the injuries found on the body, consistent with the history or the background of the case?
Okay, those patterns of the injury found on the disease are consistent with the history told by us by the police officer, where she was found missing and subsequently the body was found. Those patterns of the injury are consistent. Even subsequent visit at the scene also, you have the pattern causing the injury on her body. Yes.
In your evidence and in your report also, you said that there was no obvious grip marks or struggle mark scenes on all limbs. My question, what type of injuries that could be seen or could be found if there was an element of struggle?
Puan, just repeat the question. What type?
What type of like injuries or sign marks that can be seen on the body if there is an element of struggle?
In case there was some grip marks and struggle, we will see bruises at the finger, at the wrist area, forearms, or even on the arm. We will see the grip marks and somebody try to inflict that one. You see those bruises, maybe in the small round, or maybe patches in the wrist area, forearm or arm. So somebody was holding it.
I refer to your evidence on the subcutaneous hematoma. There's three. You explain about the subcutaneous hematoma at the right elbow and the right upper back and the dorsum of right hand. Can you explain further what was the cause of this?
Okay, subcutaneous hematoma means there was a collection of blood in the fatty tissue underneath the skin. The distribution of this subcutaneous hema is on the back of the right shoulder, on the elbow, right elbow, and at the back of the right hand. So they follow a pattern on the right side of the body. So they mean that there's some injury causing that bleeding, brand injury on the surface, or causing those injury on the body. As we have concluded earlier, this look like likely as a resultant of the fall because they're on the bony area, in the bony area.
Everything was on the one side, on the right side.
Yeah, it's predominant on the right side. All the injury here.
Could be due to fall.
Yeah, one of the possibility we are thinking of is a fall, the pattern of that, because on the bony prominent area at the back on the single arms.
In your statement and in your report, you said that the diseased stomach was empty and the mucosa was unremarkable. Can you explain what was your finding on this?
Stomach empty, Puan Koroner means that we don't find any food, any substance in the stomach. During the post-mortem by the naked eyes, we don't see any food particles in the stomach. Okay, the stomach empty could be possible not having food, or maybe sometimes it could be angonal artifact. It was vomited out. Okay, there was no food seen by us in her stomach during post-mortem by the naked eyes. Okay, so that we don't see anything. But some food particle actually was seen in the microscope. But I think it's in the duodenum. I want to see first. No, that was in the duodenum, sorry. In the stomach, there was no food. No food at all from the naked eyes there. And the mucosa was intact, meaning we don't see any ulceration, any erosion, obviously, from the stomach portion of the examination. It was intact. We don't see anything from that.
Doctor, sorry, I'm go back to the injuries sustained by the disease. Because one question I missed out on this. In your examination, was there any injuries found on the sole of the feet of the disease?
Yes, there are injuries found on the sole of the feet, which we describe. Please refer to the paragraph 23. The following marks of injury were found on her body. Please refer to page 6 under this section. Number 23, right foot plantar abrasions, 7 × 5 centimeter. Number 24, right foot plantar lateral abrasion, 3 × 0.2 centimeter. Then number 25, mid right foot deep abrasion, 2.5 × 1 centimeter. These are on the sole of the foot. Even on the 28 left foot heel, we found abrasion 6 × 4 centimeter. These are the injury on the sole of the foot.
Was this injury also consistent with the history or the backgrounds that that was told by the officer, by the police officer, that the victims was on the barefoot without?
These are the injury caused by frictions on the surface. No, if you're wearing shoes, usually you would not expect. So this injury, if you're wearing a protected shoes, so the finding is consistent with the on the barefoot on the working surface, rough working surface. This is consistent, the finding.
Now we go to your examination on the disease genitalia. In your report, you said that you did not see any obvious injury on her external genitalia, and you also said that the hymen of the disease was intact despite the decomposition change. Based on this evidence, do you agree that as far as your examination on her genitalia is concerned, there is no forensics evidence to suggest that there was sexual assault on Nora hand by the third party?
Yes, on our examination, there was no injury on the external genitalia. The hymen was intact despite of decomposition, and the sampling we took from the area also show negative, no finding of any suspicious like semina free or spermatozoa like thing. So we don't have evidence show there was penile penetrations or whatever. We don't have the evidence to say, or maybe blunt object penetration per se. But some of that minor one like touching or not may not be able to demonstrate by us. We cannot see the injury by a penetration by blunt object per se. And there's no, but we may not able to see the subtle one like touching or the minor one. That one we cannot exclude it.
Yeah, on the cause of death, you said that the cause of death is upper gastrointestinal bleeding due to duodenal ulcer complicated with perforation. Can you explain in the simple language of this term and how could it reach to, and how could you reach to this conclusion on the cause of death?
In this post-mortem examination, we actually gone through a deep details to look for any suspicious injury, to look for the unnatural death. Okay, we look for any grip marks, any obvious blunt trauma, or even we try very hard to look for any obvious evidence of smothering, strangulation, but we don't find any of those. There's no any injury from the sharp injury or we don't find all these things and include suspicious marks by a grip, a tie up or the chain cuff. We don't see any of those marks. So what we see is only in the internet examination, we found the disease have internet examination, we found, please refer to page 6 of my post-mortem report under abdomen and under intestine. Okay, this is the significant we found on the page 6 of my post-mortem report under abdomen, intestine examination, perforation at the anterior duodenum. There was a perforation also from here. Seal perforation at the posterior duodenum. There was evidence there was a perforation already sealed up from the back of the duodenum. Multiple and varying sizes of punctate out ulcers with rim of hemorrhage at the duodenum. There are multiple ulcers there. These are multiple. So these are, we see there was a duodenal ulcer. Some of them are perforated and sealed. Some of them are just recently perforation. So this is one we see the natural disease. And this is associated with the melanic stool, meaning the outerbreath we found in the distal intestine. So the perforation causing bleeding, the bleeding stay for some time, they become an outerbreath in the small intestine. This outerbreath also see in the length of column in the large bowel. You see this outerbreath also, because of perforation, bleeding, the breath already changed, become an outerbreath in the small intestine, large bowel, as well as the rectum. These are full of the outerbreath. So this is the one we will, this is the cause of that which we find in this case. And of course, we also saw some perforation evidence in the peritoneum. Please refer to page 6 of the post-mortem report under abdomen, peritoneum. 50 ml of bile-stained fluid mainly in the pelvic. So perforation also causing this fluid come out from the perforated side and it deposit in the abdomen cavity. So these are the findings we found, which in our opinion is sufficient to cause the death. So that's why the cause of death is given as upper gastrointestinal bleeding due to duodenal ulcer. Those ulcers causing bleeding, a lot of blood. The blood already undergone changes, see in the distal part of small bowel, large bowel up to the rectums, complicated by perforation. Actually, they already, I say the anterior duodenum, one of the ulcer already perforated. There was one at the back perforated and sealed. And then we have some of this perforation fluid in the peritoneum. So this is the cause of death, which we found. The ulcer, bleed, and perforations.
So what was the cause for this? What was the cause that led to this?
There are many causes of this ulcer and perforation. Many causes can be attributed, like any condition causing the increased acid secretion, any condition causing the decreased mucus protections. Some of these are common in this particular case. We were more thinking is more to a stress related tremendous stress, maybe as a consequence of the maybe not eating well and stress condition. Of course, there are other causes also. We not say other cannot be like some infections and all that. There can be H. pylori, but I think it's a stress can causing this. Otherwise, this is difficult to find a cause other than that.
Is it possible for this particular case, it is due to the not having food for such a long time can cause this type of
yeah, possible. Not having food and the stress. Yeah, because it's multiple, it's not one, it's multiple, and some of them very punch up. It's not the ordinary, it's the deep ulcer like that. Food, no food, stress. There are multiple. Actually, it's not one, multiple.
Puan, itu saja soalan saya setakat ini. Terima kasih, Dr. Siu.
Okay, thank you, Tuan Zali. Okay, Ms. Luis.
Yes, thank you, Puan. Doctor, a few questions, if I may, on behalf of the family in this case. Just to be clear, in relation to the medical cause of death, I don't have any questions for you regarding that. My questioning will be around the circumstances of Nora Ann's death, and in particular, whether we can discount the possibility that some third party was involved. Dealing, if I may, firstly with the evidence in relation to sexual assault. You've helped us significantly in that regard, but just to clarify, you say the hymen was intact when you examined her body. That's right, isn't it?
Yes, correct.
Which would discount deep penetration. Is that right?
Puan Hakim, may I repeat the question? I couldn't get it.
Yes, so because the hymen was intact, it would discount the possibility that there'd been any deep penetration.
My opinion, not necessarily. It depends what you treasure for, isn't it? I mean, hymen intact doesn't mean it cannot be treasured. I mean, if there's a assumption, I mean, it doesn't really relate, isn't it? This is if you treasure for sexual offenses, yes, but you might be treasure for something if that is the assumption. Hymen intact doesn't really relate to what you adopted for, isn't it?
So to put the question slightly differently then, you couldn't discount, could you, that there'd been a degree of penetration?
Sorry, I couldn't get the wording. May I know? Sorry, I'm just sorry.
Doctor, the hymen was intact. If Nora Ann had been violently raped, for instance, we would know about that because the hymen would not be intact.
Yeah, sure. Agree.
But you couldn't discount the possibility that still there may have been a sexual assault in this case.
Yes, I have mentioned earlier, I can see the obvious one by penetration by blunt object or even penetration with ejaculation, but the subtle form by touching and all, I mean, the subtle form, I mean, I may not able to prove. I already mentioned earlier, the violent one, like full penetration and damage one is easy, but you have the touching, a little one, that is still a sexual assault. I don't deny that is existent, but we just don't have the evidence to say that exists or no.
Understood. And previously, you also spoke about full penetration. So there could have been minimal penetration. You couldn't rule that out.
If you have such a minimal before you rupture tear the hymen, yeah, that is but usually seldom see that kind of minimal, just label medulla. Usually if the penetration should go all the way, but hymen is still intact. Unless you have very unusual, just minimal label medulla. But if you want to sexual assault, I think that is a bit not common. I do agree with you.
And in terms of other evidence that might indicate a sexual assault, the circumstances of this case might make it very difficult to find that kind of evidence. Specifically, for example, DNA evidence that may be under a victim's fingernails. In this case, we know Nora was laying in a stream and that her hands in particular were immersed in water. So it would be very unlikely to find anything, any DNA evidence there. Similarly, you tested for spermatoza. If she was assaulted on day 1, the chances of finding evidence like that on day 10 would be very minimal. You'd agree with that, Doctor?
From the evidence we collected at the post-mortem, from cutting the hair, pubic hair, and then the swab from the breast area and all the neck area, we couldn't find any evidence to say there was evidence of sexual assault at the time of post-mortem.
Yeah.
But if you say there was some very long, very minimal, yes, it's possible. But just based on what we see, we don't have the evidence of the genital injury. There's no even injury at the outer or the hymen was intact, and all the sample we sent was not found anything. But of course, I wouldn't say it cannot if have that kind of minimal or just touching. It might be yes, but we just don't have the evidence from my examination to say agree with your one.
Understood.
But I do.
But the circumstances as well. I mean, for instance, you were looking for spermatoza. The chances of finding that on a body that's been laying in a stream open to the elements for 3 days, it must be very limited. If it was there at all, it would be very difficult to find after the passage of time and the effects of the water and the effects of the elements.
Yes, if you're lying there for some time, of course, it's but this case, the decomposition was not that gross. It just starting. So there's still a high chance. But looking for the sperm is one thing, but genital injury is another more important, because we found basically the genital was quite intact. The hymen is intact. That is one thing. Despite decomposition, we are confirmed. That's why in the absence of sperm, we would think it's not. But I do agree, it can be the subtle form which can happen beyond our power of physical examination can detect those.
So leaving aside the physical examination, the bruising, all of the very visible marks on the body, and concentrating just on other evidence such as DNA, hair transfer, fiber transfer, bodily fluids, all that side of things would be compromised, wouldn't it, by being laying in a stream for 3 days open to the elements? The chances of finding that kind of evidence would be very slim.
It's a case lying but in the remote area, which nobody ever touched the body. There is a difference between lying on the street, everybody do a resuscitation. That's why I think the value is still there, because she was lying in the remote area. Nobody ever touched the body until Dr. Hanif and the police officer, really examined that. If the body was lying on the street, I think I will agree there will be more compromise on the street. There are people who are, I do agree. The body was lying in the remote area. So far, nobody had touched the body, and since she was dead. So the value is still there because the body was untouched and all that, and untampered.
But Doctor, for instance, Nora was missing for 10 days altogether. If she was assaulted on day 1 of going missing, how likely is it that we would get any physical evidence, by which I mean hairs, sperm, saliva, anything like that on day 10? How likely is that?
But if already assaulted on day 1 and if they're not major, just a minor one, yes, it would not be fine at all. I agree with you. Okay, if they're assaulted on day 1 with just minimal and that kind of assaulted, you won't see at all. But on the day 10, I can still see the hymen was intact and there was no bruises or injury on the genital area. And I do extensive sampling. I don't get one of these suspicious like seminar fluid. So, when I see day 10, I don't have the evidence to say.
Yeah. I
The
understand.
subtle one, I agree with you. It
Yeah.
would be no fighting at all. It just bypass and all. I mean, maybe just a very superficial, and you don't really put the pennies and all. I agree. I wouldn't see, but on the data, I don't find those evidence grossly assaulted one.
Can you help us just a little with the likely time of death of Nora Ann? In terms of the entomology examination, it was put forward that it was likely to have been 4 days before the gathering of the sample, which would put us on the 10th of August. Would you agree with that analysis? Would that be the most likely time of death?
Yeah, there is a little the difference between our post-mortem estimation and entomology. Our estimation is 2 to 3 days before the post-mortem, but less than 4 days. But the entomology is more than 4 days on the day of collected specimen. I would think I will go by my post-mortem examination because I have the original photo provided by the police officer, and they show the body was not up to 4 days, because in tropical country, 4 days should be very bad already. And in addition, Dr. Hanif went to the scene. I think he also had the idea the body was not that decomposed. Why there's a disparity, really don't know, but maybe the sample, the body was stored in the freezer. Subsequent, the body is not directly sampled to the IMR. We were stored in the freezer for 1 day. Some of these changes, I guess, maybe contribute to that disparity, because the body, if you see at the photo from the police officer, the first one, as well as the information given to the it's not that 4 days. 4 days in the tropical country should be very bad, all maggot already, all over. 3 to 5 days in the tropical country, in the forest, it should be all over. But the body, it was relatively fresh. In fact, the parent could identify the body on the day of recovering. But the post-mortem, the second day already very different. I mean, that is what we observed. It's very different. The day one they recover on the 13th, in fact, I was told they identify a body. But during our post-mortem, the body is changed to a different types. Maybe there's some disparity.
Your colleague this morning said the most likely time of death was either the 9th or the 10th of August based on his examination, which would put it at 3 or 4 days.
Yes, if you go by touching a 3 to 4 days, so likely about the 10. I mean, if you have that, maybe 3 to 4 days, that will be the best time. If you estimate based on the entomology and forensic, maybe touching 3 to 4 days is the optimum. I mean, if you go by 2 analysis, thinking of the limitation, 3 to 4 days is the most better estimation based on the 2 methods.
So that would put us on either the 9th or 10th of August.
10 or something, I guess. Yes.
What we know about Nora Ann is that from the evidence of her mother and the head teacher is that she was physically quite weak. She struggled with her balance and her posture. I'm just interested, Doctor, in how much you think she would be moving in the day leading up to her death. She would by that point have been starving, and would she also have been experiencing the effects of the ulcer at that stage?
Sorry, I couldn't get the questions from you. I'm so sorry, I couldn't hear it properly.
Just would like to ask you a few questions about how much she would be likely to be moving around in the days leading up to her death. Because we know, for instance, that on the 9th of August, that particular location in which she was found was searched very carefully and very extensively. Not so on the 10th of August, which is another possible day on which she passed away. How much would she be moving in what might have been the last hours leading up to her death? She was already weak, we know, because of her particular condition. But by this time, she's also not been eating, as we know from your examination, and also potentially experiencing some pain and the effects of the ulcer. How much would she be moving, do you think, Doctor, at that time?
It's very difficult for me to answer this question because I don't know the disease personally. I mean, I never know her personally. I don't know her limitation. And of course, if you are moving on an ordinary area, you can move around 10 days should be, but those are a very difficult terrain. You have to really climb down. And after that, even the police, when they brought us there, they lost the location. So those are difficult terrain. I'm not able to answer you because on the ordinary area, 10 days, you should move quite a lot of distance, but those are the difficult area. Even when I climbed down also, it was with very big difficulty. Even the police missed the orientation of the deceased body. So I'm not able to answer you because I don't know her personally. If I've been knowing her for some time, I can estimate, but this is difficult because I don't know her until the post-mortem. So I'm not able to answer this one with certainty. But those are very difficult area to move around. It's not the ordinary easy to move around like like a city or something, but it's a very difficult terrain, need to climb and all that. Even I feel difficult to go down for me untrained and all. Just for your information, this is the information I gathered.
Thank you. So leaving aside that question about the specifics of Nora Ann and dealing just with somebody in that condition, so somebody who hasn't eaten for a number of days, somebody who's been exposed to extreme heat for a number of days, somebody who maybe is experiencing stomach pain as a result of ulcers, in the hours leading up to her death, perhaps the 24 hours leading up to her death, how much do you think she would have been moving? What would she have been physically capable of doing? Would she be moving around, or would she be so exhausted and lacking in energy that she'd likely be still?
If she's at the area, it would be very difficult for her to move furthermore if you're at the final, because she have all the problem with her. But if because they will have to climb down there, and after that there was a little plateau there. If she landed a plateau area, she would be difficult to move around there because all the suffering and her disability and the pain, she would be quite restricted in that area.
Yeah.
But I really difficult to answer you. But in view of her disability, her movement problem, and all that, I would anticipate she would just at that area, not far away from there. But I'm not able to answer exactly because I don't know her when she was alive. That's the difficulty.
Okay. Thank you. You had some discussion with Nora Ann's parents, I believe, before you conducted the autopsy. And Nora's mother told you a little bit about her daughter. I don't know how much you can remember, Doctor, but if I can suggest to you various things, you can tell me whether you remember being told these various things. That she was incredibly shy.
Yes.
That she was cautious. That she was petrified of strangers.
Yes.
That she was submissive.
Yes.
That she was prone to freezing in any situation in which she wasn't 100% comfortable. Bearing in mind a person with those characteristics, Doctor, it's quite possible, isn't it, that that sort of person might be the subject of a sexual assault and freeze, be submissive, not put up any resistance, and as a result not have any of the grip marks or the defensive injuries that you might expect if somebody without those characteristics was assaulted.
Yes, we have we have an interview with the parent to get the background of the disease. Yes, those are the wording from the parent. Of course, we are really looking for those evidence on the body, looking for whether been assaulted sexually. We are really looking for those. We agree those really high risk of the being sexual assault, abuse. We were looking for those, but however, just on the post-mortem, I couldn't find it. Okay, I don't deny it couldn't exist, but I just don't find it to say it was there on the time at the time post-mortem, because we do understand the girl is a big need the dependent. She have all the characteristic and all. We actually very we are looking for those evidence hard. That's why you see we send a lot of specimen. This is not usually we do for post-mortem. You see we send the soft specimen also. We send a lot of sample 1, sample 2. We send a lot. Hopefully we get something. I still agree it's possible, but my evidence is not with you. I mean, my evidence is not show, but I agree it's possible, but I don't have the evidence to say it is there, you know. But I agree these are the highly target for this type, but I don't have the evidence from my post-mortem. Okay, we look hard and we look a lot extensive. I mean, you can see the post-mortem. Actually, it's not a simple post-mortem. We do extensive to try to look for at least one evidence. If I got one, I can use a Langsung say yes, but I don't have one. So yes, it's possible you're right, but I just don't have evidence to say it is there. Okay.
Yeah, understood, Doctor. I think all that I'd be keen for you to assist with is, of course, if she froze and allowed somebody to assault her because of her character, you wouldn't see these grip marks that you've talked about. You wouldn't expect to find them. In terms of the marks that you found to Nora's feet, perhaps in particular, it's clear that that was consistent with her moving through the jungle to some degree. But it wouldn't be possible, Doctor, would it, to say whether those marks were come about over a period of 2 days or 4 days or 6 days? It shows there was some movement, but it doesn't explain for how long she may have been moving through the jungle.
It's very difficult to date those injuries. Yeah, we know that there was a moment causing the scratches on the sole. And don't forget the 2 lower limbs also, there are a lot of scratches. But it's very difficult to date those wounds at the case of already have the post-mortem changes. And in fact, those things are going to slough up because it's just abrasions. It's very difficult to date for us. We know it's the multiple times, you know, they got multiple scratches, some of different patterns we found from there. But of course, how to date it, how many days is difficult at this stage because the body starts sloughing off already. And we are looking for abrasion. Abrasion is the first one who fall off during the post-mortem is easy to fall off because they are superficial.
The same with the subcutaneous injuries. Would be difficult to say on what day she came about those injuries.
Yes, subcutaneous, we know it's almost the same wound age, but it's not that old before she passed away because those look like still quite recent before she passed away, not the one who already organized in the yellow color. No, we still see the hemorrhage there, bearing the same wound age. No, we know this happened just before she passed away, but you don't see those bruises already organizing, showing those hemocytrin depot. We don't see that one. We know it's just before she passed away. Yes.
Did they all look like they were the same age? Does it look like one fall, for instance, rather than 3 falls?
It look like one here because the pattern is almost the same, you know. And in addition, she also have some parietal, the bruises, all on the right side. You know, most of the injury are on the right side. Even the injury on the lower limb, also the right side are more severe than the left side. Even the abdomen, you know, more on the right side.
More on the right side.
Not all, it's majority predominantly on the right side. Okay, the one on the right side everywhere.
And because we know one thing about Nora, that she did struggle with balance, but there was no evidence of a serious fall in the sense there was no bony injuries, fractured ribs, fractured wrists, even though, as you've said, the terrain, particularly there where you went, was very, very steep.
She had injury, but not up to the degree of the bony fracture because we don't find any bony fracture. Even on the radiological examination, there was no bony fracture. But
earlier you said that there was some food particles found in the duodenum. Doctor, can you help with how long food would stay there for? Does that assist in any way to ascertain when she last ate?
Can you repeat the question, please? What food?
Yeah, earlier I believe you said that when you examined Nora, there was some food particles still in the duodenum. Is that right?
Free what? Sorry,
sorry, it might. I don't know if it's some food particles.
Oh, that was under microscopic. Actually, post-mortem, we don't see anything from the naked eyes, but in the microscopy, they see some food particles in the duodenum. That is on the page 9 of the post-mortem report, histology finding under duodenum. So this is from histology by microscope, okay? Section shows some degree of autolysis. Duodenum section show extensive mucosa degeneration and widespread muscular mucosal disruption. Transmural disruption of duodenal layer also seen. Food particles seen between the disrupt layer. Pure stain was negative. This is based on the microscope. They can see some food particle, but on the naked eye, we don't see anything.
How long would the food particles stay there? If she'd eaten on day 2, are there food particles there on day 4, or is it not as specific as that, doctor?
We don't see anything from the gross. Maybe some of the smaller trap they can see in the microscopic, because grossly we don't see. In the normal one, you say a normal food, you take about 8 hours plus to fully digest in a normal healthy person. But microscope, macroscopy, naked eyes, we don't see. But microscope, they still see some food particles. This is very difficult for me because it's not from it's under the microscope. Okay, it's under the microscope. Ordinarily, we all, as ordinary healthy person, about 8 hours for a food to be digested. But this is only on the normal healthy, but not a person under stress or under that unusual, because we have cases, patient die after a few days in the food is still undigested. That is not applied to the abnormal case.
Does it
normal
help?
Person,
Sorry. Does that piece of evidence help you to decide when Nora last ate?
No.
No,
because it's a known fact that if the stress under tremors, the food will not get digested, even days and days. These cases we see, people under stress, operation or trauma, the food can remain there until they die, even they're not supposed to have food in by mouth. So it's difficult for us to help us to
Doctor, just to clarify a few final points, if I was to suggest to you the theory that perhaps some third party at some point had some involvement with Nora and then released her in the jungle, you could not, from your examination, discount that as a possibility. It's possible, isn't it, from your examination?
Yes, it's possible. I don't deny that it's possible, but I just don't have the physical evidence to say yes or no. But of course, these are possible. But we not beyond my physical examination can prove or disprove.
Thank you very much for that, Doctor. Thank you.
Thank you.
Okay, thank you, Ms. Luis. Okay, Mr. Alif.
Okay, hi doctor, I'm the lawyer for the resort. I don't have much questions from you because your findings and your evidence with Dr. Hanif are more or less consistent and the same. So I will not waste the court's time. I just want to ask you about the meeting that or the information that was provided to the parents to you prior to the autopsy. Okay, were you ever informed that the whole family had booked a 6-hour jungle trek for during the duration of the stay, which includes Nora Ann?
I was told they have some exhaustive trip after they check-in the hotel, and then they were exhausted and go to sleep. There was a portion of this the trip, but I cannot recall what type of trip is it.
No, I mean they what happened was that the mother actually booked a 6-hour jungle trek to be done on, I think, on Monday, 2 days after they landed. Were you notified about that?
That one I'm not my awareness, but I just know after check-in there's some activity.
What they did after they checked in,
that one I didn't ask for the 6-hour trip after on the Monday, but the check-in they have some activity before they sleep.
Right. Okay. And then were you also notified that I know they said that she has problems with balance and all that. Were you aware either by the police or by the parents that throughout when after Nora Ann landed in KLIA, she was walking throughout the way until they got into the taxi? Are you aware of that?
I was told, but I was told. I didn't see. Right. Okay, I'm not able.
Right. By the parents or by the police?
By the police. I was told only, but I'm not able to comment. These are all hearsay.
Right.
I didn't.
Correct. I agree. And a lot of things us have been speculation and possibility, which you cannot agree, you cannot confirm or deny.
Yes, that's right. It's a hearsay from the police.
Yeah. And were you also aware that Nora and who's involved in a bicycle club, basketball club in her school. Were you aware of that?
That one I'm not aware. That one I'm not aware.
Right. Okay. That is all my question. I just wanted to know exactly what was communicated to you to assist you with your autopsy. Thank you, Doctor.
Thank you.
All right. Thank you, Mr. Arif. Okay, Doctor, I have a few questions. Okay, my first question is with regard to entomology. Okay, my question is, what is the position of entomology in autopsy, and to what extent the report could be set aside or varied by the pathologist?
Okay. Entomology examination is important, especially in the later stage of the post-mortem changes, when we have difficulty to assess the degree by our post-mortem, by pathology examination, we have difficulty to assess the post-mortem interval, because when they're fully investigated by the larva and maggot, we will send for the help. So usually it's helpful in the later stage. But in this case, the body was still quite fresh. We are quite confident it won't be more than 4 days. So there was some disparity, mostly because the way the sample, the body was kept. I'm guessing those are the factors. Why there was so much, there was more than 4 days, we say it's less than 4 days. Yes. And because we are the one who examine the body, I will go by my examination. And then in fact, the police have the photo and the taken at the scene. Those are not really 4-day decomposition. Those are the fresh.
So it depends on the condition of that corpse.
Yes,
right?
Actually they will help in the later stage. But this one, I think we are correct, because
I see that you didn't find any difficulty in determination of the time of death.
No, because there was one coroner, because Dr. Hanif went to the scene. Yeah. That is the most important. Yeah. Subsequently, we also examined the body a day after. So we already had two times on the different ages. Mm-hmm. But there was a really drastic change of the body when we moved the body from the early photo from the police, and the parent go and identify the body. When during our postmortem, the parent, have a different type of appearance. Mm-hmm. So we know there was some drastic changes on that.
It's not compulsory for the pathologist to totally adopt any finding.
It's a supplemental, to help you. If they agree, that's good. But when they're not agree, then we have to see, because we have the evidence, the body. And they are only receive the maggot from us. They don't know the actual case, how it look like, because we have the photo, everything to back us and all that. We went to the scene, but our colleague maybe just get the sample for us. Yeah. So in this case, I will take our estimation is more reliable.
Okay. My next question is about the visit post the autopsy. The visit that you done, that you and Dr. Hanif went to to have these visits where the location where the disease was found. Okay, maybe you can share with us the detail about the visit, the reason of that visit and why.
After the post-mortem on the 14th, we think we need to go to the scene to expand those injuries on her legs and the sole, because there are so many scratch marks, yes, by the tree branches. So we want to know how she can get those injuries. That's why we asked the police to bring us to visit back whether this injury pattern is tally with the injury sustained when she was there, or maybe we want to make sure those injuries she sustained over the area and not people inflict on her.
Why those areas? Why you and Dr. Hani went to do the visit because of that area? You went to confirmation about that area. Not the area where the disease was found, but the area in the body, where you said that about the leg, the injuries to the leg and feet. So you want to confirm the injuries. So why that area?
We actually want to see whether she was still walking or not. Those are things she was standing alive and still walking. Mm-hmm. So we are interested to area whether she was walking or not. If she walking means she was not immediately dead after she missing. So we are actually want to know whether she was still walking around after those alleged missing period. And we see those injury pattern is Similar like those areas we can see from the branches and all the prickle from the.
And your finding was?
Yes, those are consistent. We want to say she was still alive and she's not dumped in the area and make some artifact on the body. You know, that is one of them. Of course, we want to know how. Of course, we are very suspicious. We try to look for that, but yet we still cannot get any other than the natural from the gastric and duodenal perforation. We actually want to understand how can it has such a bad duodenal ulcer, and then I mean this is a lot of ulcer and some perforated, some are okay. This is not the common one. But of course, understanding that there is tremendous stress in that area. If you are alone in that dark area, even I have difficulty to go down. Even the police can miss the dead body location on a field. I mean, you can see how horrible is the circumstances she was in to understand why you have such unnatural ulcers on the young girls and some of them perforated and deep punching. We want to know why.
So you mean that even if somebody is in a stressful situation, she or he can get this kind of peptic ulcer, although there is no existing ulcer in the stomach, in the duodenum.
Yes, it's stress. You have ulcer. I mean, like your burn, you have some curling ulcer. Some of those are stress, but of course there are many factors. You're using drugs and all. But just want to know why the ulcer was so bad in this girl.
Yeah.
I mean, if not ordinarily, we expect one or two, but this is a lot. If you see the post-mortem photo, there are a lot of ulcer. This is very unusual for us to see, you know, in the normal post-mortem. We expect one perforation common, but this is a lot. I think the post-mortem photo have a group of the one, we taken the whole sample, that it's not usual. So there must be something more than the normal, I mean, stress.
So
this is tremendous. Very tremendous. If the dark area with all the, I mean, alone and all that, this are quite. I mean, even I is feeling horrible if I'm. That is not a normal area which we expected to be landed.
Okay, understood.
So just to understand and of course we can interpret our findings.
I see. Alright. Puan, Tuan, ada soalan tambahan?
Kita ada.
Okay.
Saya tak ada soalan lanjut untuk doktor.
Alright. Okay, thank you very much, doktor.
Thank you.
Okay, saksi dilepaskan dan dibebaskan. Okay, macam mana, Tuan? Ini memang dua orang je?
Dua orang je.
So esok kita ada siapa?
Besok kita akan ada
Tuan Tamalinggam dengan ACP Nik Ezani.
Nik Ezani, ya.
Dua orang lah.
Dua orang.
So
dua orang. Sebenarnya kalau kita ikutkan Puan letakkan empat saksi
kan?
itu daripada besok
apa
sampai
ni IO tak boleh standby? IO tak boleh standby esok?
Kalau
tak boleh.
Dia tengah, kalau boleh dia nak bagi keterangan selepas besok.
Okay, alright. So kes ditangguhkan sehingga esok pukul 9 pagi dengan Tuan Tamalinggam dari pihak forensik dan juga ACP Nik Ezani. Okay, thank you very much everybody. Mr. Sakti, Luis, Lydia and Alif, thank you very much.
Much obliged.